All right, good morning, everyone. Thank you for your patience. I think I am now seeing all of our board members. So Leah, do you want to officially open the meeting up, and then we can get into, I have a lengthy narrative to read to you all regarding meeting procedures, but I'll let Leah officially open the meeting.
This is Leah Roselyn, Chair. Good morning, everyone. So we are calling the meeting to order at 8:34 by my cell phone time. Danielle, can you please give some introductions and instructions for the meeting?
Absolutely.
Or do we need to do roll call? Okay.
Yep, I will go ahead and read through some of our meeting, our updated meeting procedures, and then we'll jump into roll call and our very first item. So thank you very much. This meeting is being recorded and broadcast on the city's YouTube channel and public access cable channel 25. During the meeting, when you are not participating, please mute yourself by clicking on the microphone icon found on the lower left-hand side of the Zoom menu next to the video icon. When you are muted, a red line will appear over the icon. Muting your microphone during the meeting will make it easier for everyone to hear. You'll just have to remember to unmute if and when you want to speak. In some cases, I may mute or unmute people as needed to minimize distractions during the meeting. Please remember to state your name every time you speak for the benefit of those listening remotely. You can turn your video camera on or off by clicking the video icon in the menu. For the purposes of this public meeting, when you are participating in the meeting, please do keep your video on. When you are not participating in the meeting, it is okay to turn your video off. You will still be able to listen to the meeting when your video is off. You'll just have to remember to turn your video back on when you are participating. Turning your video off when you are not participating will help make sure the active meeting participants can be seen on the screen. In some cases, I may turn someone's video off if they are not actively participating to avoid distraction during the meeting. You can always turn your video back on. If you are participating by phone, you can click *6 to unmute your phone. For those using Zoom, somewhere on your screen, you will see a choice to toggle between speaker and gallery view. Speaker view shows the active speaker, and gallery view tiles all the meeting participants. Board members and city staff members, you must state your name and title each time you speak. All motions will need to be stated clearly. After a motion is made and seconded, the chair will call on board members individually to provide their vote. Chair, you will then need to announce whether the motion carried and the count of the vote. When public comment is sought on an item, individuals participating via Zoom should use the raise your hand feature. Windows and Mac users can access this feature through the participants button on the bottom of their screen. Android and iPhone users can access this feature through the More button located at the bottom right corner of the screen. For those calling in by phone, you may dial *9. Individuals will be called upon by name in the order they appear on the meeting host screen. When you are called on, please unmute your listening device and state your name before speaking. The chair will then call for in-person public comment for those without access to technology options. Staff present will direct you to the podium to speak, following social distancing and safety protocols. The regular 3-minute time limit will apply. One other brief element I want to go through related to public comment, and then I will turn it back over to the chair. So related to public comment, the chair will open items up for public comment and ask if there is anyone present via Zoom that wishes to comment on that particular item. Again, participants, you will raise your hand virtually or physically, and I will direct you at the beginning of the meeting, or I will direct you as to who is up next to participate in that public comment. So we do have a number of folks on our call today, so we may be getting some public comment. So please bear with us as this is a new component for us, but feel free to physically raise your hand or use the raise your hand feature actually in the Zoom tool. So with that, I will hand it back over to Leah to take roll call and jump into our meeting agenda.
Thank you, Danielle. This is Leah, Roselyn Chair. I understand that there are some new members of the board, and so I will do roll call with the members that I am familiar with, that I know, and then Danielle, if you could assist with introducing the new members. Thank you. Okay, so let's go into roll call. Joda. Joda is present. Peter.
Here.
Ethan.
Here.
Leah Roselyn. Who are new members?
This is Danielle Bushcutter, Staff Liaison. Our first new board member is Tim Giblin.
Here.
And our second new member is Chris Cohart. And I apologize, Chris, if I did not pronounce your last name correctly.
You got it. I'm here.
Hi, Tim and Chris. It's so great to have you on this board. Thank you for joining us for this very long meeting. What a great time to jump in.
Yeah, happy to be here.
Thank you. Danielle, are we ready to go into approving minutes, the first action item?
Danielle Bushcutter, Staff Liaison. Yes, you can go ahead and jump right in.
All right, thank you. So the first action item on our agenda is to approve the meeting minutes from October. We didn't have quorum last month, so we weren't able to approve those minutes. So there's a link embedded in the agenda if anybody has questions. Any changes? Somebody like to make a motion?
Tim, I'll make a motion to approve minutes.
I'll second.
Motion made by Tim, seconded by Peter. We need to, I need to call on everybody individually. Is that correct, Danielle? Okay. Ethan.
Aye.
Christopher.
Aye.
Joda.
Aye.
That's an aye for me as well. So the motion carries unanimously. Let's go to the second agenda item, approving the minutes from November 13th, so our last meeting.
This is Ethan. I would move we approve the minutes.
Moved by Ethan.
I'll second. Tim,
Seconded
I'll
by
second.
Ethan. Thank you. Let's go to roll call. Joda.
Aye.
Peter.
Aye.
Chris.
Aye.
An aye for me, so the motion carries unanimously. All right, so the first, the first agenda item on letter C is to provide a funding recommendation to the City Commission for the use of 2021 funds. Now, Danielle, the public comment isn't until agenda item E, but I would assume that many of our guests are here to speak on their proposal. So I'm wondering if we can move that up in the agenda and hear their comments now.
This is Danielle Bushcutter, Staff Liaison. I think you can handle it a couple different ways. I think you can certainly do that. The other thing that you could do as well is go through kind of the, I think most of the folks that I see on the call are here related to talk to their particular application, because this was one of the first years that we've really invited and encouraged applicants to join our meeting. And so the other way that I think you could handle it as a board, if you wanted to, is to go through all of the applications and ask if anyone from that particular agency is here and would like to provide a brief presentation about the application. And then at that point, kind of go through any of the questions that you all may have related to each application. I've seen that work with a couple other advisory boards, and I think it's been successful. So I would also suggest that if you all are open to it. And I can also provide a brief overview just because there was an update that went out yesterday. So we did get our final disbursement, our final quarterly disbursement of liquor tax just earlier this week. So we were able to kind of update that amount for you all to consider today, which I had kind of foreshadowed, but we didn't really have a good number until yesterday. So the updated number that you all saw in that spreadsheet that just lists all of the different agencies is $692,000. So about a 6% reduction from what it was last year, but more in line with where we think 2021 is likely going to go. And again, there may still be some spend down of fund balance, but we will continue to keep you all updated on what that's looking like as those quarterly distributions come in. They have been very volatile this year. Typically, we see a little bit more consistency in those numbers, but they have been significantly volatile this year. So just something we'll continue to watch, continue to monitor, and continue to keep you all updated on. But we thought this was a little bit more in line with what we are kind of expecting and what we have seen as of late. So wanted to provide that update, but I think that's all I really have unless any of you all have any questions for me.
This is Leah Roselyn, Chair. I'm wondering if we can get a sense of the organizations that are here. I see Hearland and Ballard and Van Gogh. Are there other applicant organizations on the call?
This is Danielle Bushcutter. I can kind of go through the list. I also see Bert Nash, and I think there's a couple others. I was going through the list of registrants, so let me pull that up as well. And if you want to, you could go just kind of alphabetical, do kind of a call to see if anyone from that particular agency is present and would like to present. And then if not, we can kind of skip over those and address those at the end if you would like.
Okay, thank you. So I want to open it up to the board for discussion on how you all would like to do the process of reviewing the applications and hearing from the applicant agencies. So there are two recommendations. One is we can sort of go through the list of applicants, discuss their applications, and then hear from the representatives. Or we can perhaps hear from all the representatives and then start our discussion of the applications.
This is Ethan. I think we should hear from all of the representatives first, just so that we know the totality of what's out there in all the applications before we begin discussing them.
This is Peter Carter, board member. I would agree with that.
All right, thank you, Ethan and Peter. Are there any hesitations or concerns about using that process, first hearing from all the agencies and then getting into the applications and discussing those?
I would agree with, this is Chris. I would agree with Ethan and Peter. I would also give the applicants the opportunity to say their piece, and if they don't want to stick around for the whole meeting, they can scoot out and do other things.
Mm-hmm. Thank you, Chris.
This is Joda Totten, board member. I agree with my colleagues.
Okay, thank you, Joda. And I saw Tim nodding. So it sounds like the board is in agreement that we'd like to go ahead and hear from all of the agencies now and then give them an opportunity to leave since they're very busy people, if that's okay with you, Danielle. Okay. So is there an order in which we want to do the speakers, or should we just start alphabetically and start with Bert Nash? Go down the list that way? Okay. So Danielle, do we actually need to do anything to change the agenda order, or are we okay okay.
Danielle Bushcutter, staff liaison. You are more than welcome to just invite each applicant that is present to provide a brief presentation, and we don't need to reorder the agenda.
Okay, this is Leah Roselyn. Thank you so much for all your process help. So we are so excited to welcome representatives from these incredible agencies, and we'll start with Stephen O'Neill with Bert Nash.
Good morning, everyone. I'm Stephen O'Neill, Chief Operations Officer at Bert Nash. I'm not feeling great this morning, so my voice might be a little off, but I am really happy to be here to talk about one of my favorite programs at Bert Nash, which is the RAP program. And then I will plan to stay in case you have questions when you are reviewing the applications. So our RAP program integrates behavioral health services into the schools in Douglas County. Most of those are in Lawrence, just due to the size of the school district. In Lawrence, we have 2 RAP specialists in each high school, 1 in each middle school, and we have 3 RAP specialists that split 6 elementary schools. The program has expanded and contracted over time since 1997. At one point, we were in every school in Douglas County. We've gone through a several-year period of expansion. In 2018, the Douglas County voters approved Proposition 1. Part of that allowed for expansion in the RAP program. We currently have 19 RAP specialists in Douglas County. We currently have 1 manager. That's been one of the challenges. Is it's challenging for 1 human being to support 19 other human beings at the same time. Probably the most material or significant thing that may stand out to you in our application is that last year our award was 307 and our ask for this year was 390. That is our that's the true gap, that funding gap that exists in the program. And the last 2 years, we've really tried hard anytime we're putting together a proposal or costing new business to really evaluate our true cost. Because if we don't do that, we end up having to underpay our personnel or understaff our programs, which leads to turnover and burnout. And we're really committed to trying to care for our workforce. Other key developments or changes in the RAP program is that 2 years ago, we switched all of our RAP specialists to a school year schedule. That was, again, to help us with recruitment and retention. Our RAP specialists could go to a school district for more money and work 9 months a year. And we decided that if we were going to be a competitive employer and continue to have a program that we can be proud of, our RAP specialists deserve that same arrangement. That's actually worked out really well. We have not had any turnover since implementing that change 2 years ago in our program, which has created a lot of consistency for students as well as school personnel. Our RAP specialists do a lot of different things. They provide substance abuse and mental health initial services for students. They facilitate groups. They provide a lot of support to teachers and building personnel in developing both district and building level strategies for supporting students. This year has been, I think, for all of us, interesting, challenging, full of opportunity, but our RAP specialists have been highly engaged throughout the school year, both on-site and through the use of telehealth. Zoom is our primary telehealth platform, but we also have other platforms available to us as well. In fact, in about a week in March, we converted our organization to almost 70% or telehealth services in under a week. So we've deployed a lot of technology, and our school partners have been really great. Another key development is that over the last 2 years, for the first time, all of the districts in Bert Nash got together and we agreed on certain commitments around the RAP program, what it was, how it was going to be used and supported in the school district. And then the last big development that is sort of peripheral to RAP is that we have doubled the size of our community-based program for kids, which is case management services to support kids and parents. And we've doubled the size of that program, going from 6 case managers to 12. And through partnering with the school districts, we've actually integrated all of those staff into, or are in the process of integrating all of those staff into the school system. And while that's not a direct investment in the RAP program, I think it's a peripheral investment that directly benefits and supports the students that the RAP specialists are working with and highlights our commitments to the program. So I'm very proud of our RAP program. I am proud of our RAP specialists. I'm proud of our manager, Carla DeHate, who's been with our organization for almost 18 years. So I'm incredibly proud, and I'm incredibly thankful of the strong support that we receive from the city of Lawrence and from Douglas County, as a program like this is very unique and very special. And is not possible without funding like this. So thank you so much for allowing me an opportunity to talk a little bit this morning. And Danielle, I want to thank you for being really supportive through the process. I know I asked a few questions as we were working through the application, and you were very responsive. So with that, I'll stop talking. I would like to stay in case you have specific questions on our application, but I'll turn my video off and leave you with the soothing image of Bruce Willis in Nakatomi Tower.
Stephen, thank you so much. Before you go, actually, sorry, this is Leah Roselyn, Chair. Before you go and leave us with that beautiful image, I'd like to go ahead and open it up for questions, if that's okay, if the board has any questions about your presentation. Daniel, is that okay for process?
Danielle Bushcutter, Staff Liaison, absolutely.
Okay, thank you. So what questions do folks have? Thank you so much again, Stephen, for being here and for that.
Yeah, it's my pleasure. Thank you.
So let's open it up for questions from the board, if there are any.
This is Ethan, and I almost hate to ask this because it's not a fun question, but what would the implication be for RAP if we were not able to meet that 390 number and had to keep it at 307 potentially? What would that mean for the program and staffing and personnel?
So Ethan, that's a great question, and one I actually thought about over my first cup of coffee this morning, because I was certain that would be one of them. So 390 allows us to expand the clinical oversight and supervision of the program by adding that second manager, so that we don't have one person clinically responsible for 19 people, which is really challenging. 307 is probably a number that, while we would like more, I think everyone in this town, all of the other agencies are also in significant need. And I think 307 is a number that, while not ideal, is palatable for us, and we could probably mitigate any direct impact to children, other than the impact that comes with a RAP specialist who may not be getting as much support or supervision as they need because their manager's trying to manage 19 people. But again, given the environment that we're in, I feel it's really important to be transparent. So I think that 307 number would be palatable. And I also want to acknowledge, Bert Nash, we're fortunate in a number of ways as the RAP program does receive a lot of community support, and it also gets a foundation transfer from the Bert Nash Foundation every year. I think anything less than 307 really pushes us into territory where we might have to make some different decisions, because I think the year before that we had 305, and our expenses do increase year over year. But thank you, Ethan, for that question. And hopefully my response was helpful.
Yeah, thank you so much. I really appreciate the candor and transparency. That was really helpful.
Other questions? This is Leah Roselyn, Chair. I have a couple questions about the budget as well, Stephen. So in looking at your budget for personnel, how much of the city funds that are requested under the personnel would be providing salaries for RAP workers? In other words, how much of that is rolled up in other administrative costs, or is that all allocated for the RAP
That's
workers?
all allocated for RAP specialists, and there's a portion that does go to cover a percentage of the supervisor's time. But for example, there is no director level time or my time or our CEO's time rolled up in that personnel number. If you look at the budget spreadsheet under operating expenses, there's a 52,860 number that would include things like a small allocation of my time, HR, finance, things of that nature. We opted to for R390 to go directly to support the salary and benefits of the staff doing the work.
Great, thank you so much. And then I had one additional question. Since this is City of Lawrence funding, you mentioned that you have RAP specialists throughout the county, but the majority are in Lawrence. How much of this is going to cover Lawrence positions?
So that's a great question. The way we build the budget for our request is you're seeing the total budget, like the big number is our RAP program in total. That 390, we actually, to get to that number, we carve out just the cost of those RAP specialists and the portion of the manager's time associated with supporting the schools in the Lawrence school district exclusively. That's something we've actually gotten pretty good at, because if I'm in a county meeting, I get a very similar question, and the RAP funding pie chart, it's diverse in terms of kind of what we do to support the program, but we do carve that out, and we're able to report on that out by school district, and that's really helpful for, I think, groups like this or taxpayers who kind of want to understand where their investment in this program is going.
Leah Roselyn, Chair. Thank you so much, Stephen. That was incredibly helpful. Are there any other questions from the board before we move on? Okay, well, this is Leah Roselyn, Chair. Thank you so much again, Stephen. And I understand you will stick around and we will enjoy your screensaver or your Zoom image. The next on the list alphabetically is the Boys and Girls Club of Lawrence. I don't see anybody on my screen. Is there Danielle, do we have a rep?
Danielle Bushcutter, Staff Liaison. I do not see.
The rep for Boys and Girls Club or DECA. I also talked to Becky as well. So I think we can go ahead and jump down to Ballard. And I do believe we have a representative from Ballard.
This is Leah Roselyn, Chair. Wonderful. Oh, I see Becky just turned on her screen. It says Charlotte, but that's Becky.
Charlotte's on as well.
Okay.
So we have two from Ballard.
Wonderful.
Hello, everybody. My name's Becky Price, and I'm the director of Ballard Center. I wasn't expecting to do a presentation, so please bear with me. We so appreciate the funds from the city, and it's so vital that the city supports our local agencies. Ballard's been around for decades, and what most people think of with Ballard is our Early Childhood Education Center. But the funds that we are requesting are for the safety net or wraparound services that we offer not only to the kids and their families, but to community members as well. Like everybody else, I'm a little bit tired of talking of the pandemic, but it's kind of hard to not address it because we've been very, the work that we do has increased a lot. And it's been a tough time. We've served during the closing, the shutdown, we served over 8,000 or delivered over 8,000 meals. But so the funds from the city allow us to continue our safety net or wraparound services, which cover our therapist, our family connections staff person, and allow us to serve, as I said, the entire family. Explaining our wraparound services is just always the hardest thing. It can be everything from, we have a pantry where families can come and get food, diapers, hygiene products, clothing, basic household goods. We also assist in the emergency service, rent and utility assistance. And so it's pretty much anything that a family needs, and it can go from one extreme to another. We've been fortunate this year. We are good at getting free help. Legal assistance is often very important. And we have 4 different attorneys that will help us out pro bono, and that can really change a family's life. But our goal is always to have the families to help break down barriers so that they can become self-sufficient. The increase in the number of abuse, domestic violence issues, and the families that have never had to ask for help. And it's very humbling and hard for them to do so. 60% of Ballard's tuition is not covered by the students. And so that's what a lot of the advisory committee of this funding would cover. We so that if we did not receive it, it just means fewer children that we could keep in the school. I have a lot more that I could say, but I think maybe questions would be easier. Sorry.
Thank you so much for being here, Becky. Let's open it up for questions from the board. This is Leah Roselyn, Chair. Well, Becky, because your program is a little bit different than some of the others, I think it might be helpful if you could perhaps explain the connection to the board with the link between early childhood education and wraparound services and the goal of this funding, drug and alcohol prevention and reduction.
Sure. And Charlotte, feel free to jump in. I have Charlotte, our COO, who writes most of these grants. She has become an expert at getting CARES funds and is very familiar with this grant as well. I'm trying to find the statistics specifically, that children, especially those raised in poverty or within low income, how early childhood education is vital for them to be able to be successful and grow into caring adults, and it reduces the likelihood of growing up and becoming and using drugs or alcohol. Charlotte, can you step in and explain a little bit? Oh, you're muted. Oh.
There we go. Thank you. This is Charlotte Marthaler. I'm the Chief Operating Officer for the Ballard Center. And just to kind of tag on what Becky was saying, there's a whole lot of evidence out there that talks about the connection between early childhood education and later success in life. And one of the things that we think is so awesome is we're talking not just about the child that we serve at the Early Childhood Education Center, but also their family is able to benefit from early childhood education. And so our goal always is to keep our rates low so that we are available and we're not keeping especially low-income families and families of color away from services like early childhood education. So that is really one of our priorities and goal, is to make sure that we're accessible to all families in the community. There's also a huge body of research out there that says that safety net support is also evidence-based for helping families to be more stable, to be in a more stable environment. And as that relates back to drug and alcohol prevention, certainly we know that the more well-functioning families are, the lower stressors that they have related to finances and whatnot, the better able they are to keep jobs, care for their children, do the things that we know make for a successful family life. So that's where these funds and our opportunity to be evidence-based is really important and helps to reach the goals for this particular funding.
This is the Roselyn Chair. Thank you so much, Becky and Charlotte. Are there any other questions from the board? All right, well, thank you so much to you both for being here, and we welcome you to stick around if you would like, or it was good to see you.
Thank you so much. We appreciate you all volunteering your time and helping our community. Have a great day.
Thank you, friend. Okay, moving on. The next on the list is Hearland Community Health Center, and we have Robyn Coventon here from Hearland. Welcome, Robyn.
Hello, everyone. Thank you for your time today. I will do my very best to keep this brief, and I'll start by just saying thank you for the many years of support that we have received from the city. What the support from the city has meant to Hearland is a longer-term investment that's aligned with Heartland's mission, and also aligned with our responsibilities as the federally qualified health center in Douglas County to use the federal funds that come into our community to leverage other resources when people recognize the value of comprehensive integrated care. And so, with the support that we receive from the city, particularly for our integrated care model, which is taking primary care and bringing in a behavioral health component that includes for all patients screening for alcohol use disorder or substance use disorder, and using evidence-based approach of SBIRT, that's really allowed us to care for a magnitude of patients. And it's fully aligned with, I think, what the needs of our community are. And so I am happy to talk about it, but I really just wanted to come and express my gratitude and my hope that we would be able to have and count on continued city support. But it's a critical program. It's a program that has been growing. It's a program where utilization from our community members continues to increase, and we anticipate that we will have served about 15,000 patients for this next calendar year. We're on track to serve over 10,000 for 2020, and 2021 will, easily hit 15,000. And so to have the support to be able to do this, it's just critical. And forgive me, I'm in the midst of an asthma flare-up, so I may go in and out, but I apologize.
Thank you so much, Robyn. Let's open it up for questions from the board.
This is Ethan, or Joda, go ahead.
Oh, thanks. It takes me forever to do this. I'm not like savvy with you like you guys are. I mean, right now I'm working from an iPad, so. I have a question. We heard from another service provider earlier in the year who just came in to present, and this person mentioned that it would be better not to even get any money because of staffing. They were using primarily the money for staffing, and as much as they were grateful to have the money from the city, it actually made things kind of tougher in a way. I don't know whether I'm making myself clear, but how would it, I see that you're using the funds for the nurse practitioner and mental health specialist. Are these people that would be new to your program, or are they people that you currently have on staff? How would it impact that?
Yeah, these are people that we've currently had on staff as we calculate our annual budgets, and we're required to submit an annual budget back to HRSA, our federal grantee. Mm-hmm. We factor in all of the different levels of support. So when we use money, when we use funds that come in, whether that's through philanthropy or city money or county money or private entities, whatever that's looking like, we've accounted for that down to the penny. And so this would be a continuation of a program that's been supported by these particular funds for several years now. And so the impact of not having those funds would be really some last minute scrambling, because we do go down to the penny and we have it factored across, is this supported by United Way funds? Is this, and we can track it down to that very level. And so we'd have to really take a long, hard look, because, it doesn't, of course, fully support that program. It doesn't fully support those 2 staff positions, but we also, there is some program income that comes in, clearly not enough to cover the full range of salaries. And so we'd have to look and see, could we manage this? Is there a way we could reshuffle the budget that we submit? Is there a way we do that? Or do we have to look at making more difficult choices?
Mm-hmm, mm-hmm, mm-hmm.
Thank you, Robyn.
Thank you.
Ethan, did you have a question?
I did. Oh, sorry, this is Ethan. I did, but Joda pretty much got to the peanut there. Thank you.
This is Peter Carttar, board member. A more just overarching sort of generalized question. Recently, we've heard in the paper that Hearland is purchasing or has affiliated with a for-profit pediatric group. Is that? And I'm just curious how that dovetails with the nonprofit aspect of your business as you roll forward. On one hand, you're looking for funding for these kinds of services, and on the other hand, Hearland is making what looks like sort of a disconnected action. And I'm wondering if, Robyn, you could offer us some words in how to think of these things in the same boat.
Sure, of course. And that's a very, very valid question. So Hearland will be acquiring Panda Pediatrics here in Lawrence. Panda Pediatrics currently in its existing state is a for-profit entity. Obviously, as a 501c3 nonprofit, Heartland we have a very different model of care. What we do, we offer care to anyone who walks through our doors, whether they have insurance or not. We offer services on a sliding fee scale. And so what will happen prior to January 1st, or actually right at January 1st, is Panda Pediatrics, the for-profit entity, is dissolved and they go away and they roll into Heartland's model of care, into the 501c3 nonprofit, which will allow pediatric patients who may not have their family may not have ability to pay. It will offer them services on a sliding fee scale. It will offer them the integrated care model that doesn't currently exist at Panda. So they'll have access to oral health on site. They'll have access to behavioral health on site. And so they will do that while offering sliding fee scale, while seeing anybody who walks through their door. And so I think that it's perfectly aligned with what our mission is. It just takes that existing for-profit model and says, nope, we don't want that. We're going to put that aside and we're going to roll you into the model that exists currently so that we can provide more affordable, more accessible access to anybody walking in, not just those who are walking in with a, Blue Cross card or an Aetna card. So I don't know if that fully covers your question, but it's kind of an overview.
As an overview, it's very good. And thank you for that.
Mm-hmm.
Leah, Roselyn, Chair, are there any additional questions from the board? Well, Robyn, particularly since we have a couple of new members on the board who haven't had the opportunity to discuss this in the past, I think it might be helpful if you could give a quick summary of the model of integrated care and how that connects to drug and alcohol prevention and intervention.
Sure, of course. So in a comprehensive integrated care model, our entity aims to serve all aspects of healthcare. So we're looking at serving not just the physical needs that exist, we're looking to serve in ways that include oral health, which include behavioral health and psychiatry. And as part of that, we have to look at alcohol use disorder, substance use disorder. And so when a patient's coming in to Heartland, whether they're seeing a dentist, whether they're seeing a behavioral health provider or a primary care physician, or come January when they're seeing a pediatrician, part of that intake process is doing a brief screening intervention. So using like the audit tool, which is the alcohol use disorder test, or using the DAS test, which is the drug abuse screen test. And so as part of bringing them into the patient-centered medical home, which Heartland is a recognized patient-centered medical home, meaning that we take care of all aspects of health for that patient, we find out what those needs are. We find out if it is a behavioral health need or if it is, enabling resource. So we're looking at, are they housing insecure? Are they food insecure? And so we have a food pantry on site. We have great relationships with other nonprofits so that we can connect people into resources. It's an oversimplified analogy, but one of the things I like to think about with the patient-centered medical home and integrated care is, when you are going away from home for the very first time and you have to buy car insurance, or you have to figure out, okay, I've had a car wreck. How do I access, what do I do? Who do I call? The first thing you do is you call home. So if you have a need, you call home. And that's kind of the same concept of patient-centered medical home. If your arm starts getting this horrifically awful rash, or you've got an ingrown toenail, you call your home, your patient-centered medical home. And what we do is we get you into the care that you need, whether that's medical care, or we get you the social services need that exists, and we put you in so we can start wrapping those services around you so that anytime you have that need, we're here to attend to it and get you into the right resource to take care of those needs. And so the integrated care model, our dentist may be seeing a patient and they're going through a screening, or they notice that their blood pressure is really high. So they may put them over into, let me have you take a quick conversation with our primary care doc, or they seem just really anxious. And so they go through, one of these screening tools, and they find that there's, there's a need for them to talk to behavioral health. They say, we're going to take care of your oral health needs today, and then we're going to have you talk to Cindy Treaster over here in behavioral health. And they make a warm handoff. And what we've found in doing that warm handoff is people, when they see that person face to face, they're more likely to come back in to get the service that they need. And so that's kind of the whole concept of integrated care. We're going to care for the whole person, and we're going to do it in a way where it's a multidisciplinary approach.
This is Leah Roselyn, Chair. Thank you so much, Robyn. That was really helpful.
Thank you all very much for your time.
Thank you for being here, Robyn. Okay, let's move on to, is anybody here from Biggs? I'm not seeing Jack. Okay, Lawrence Alcoholic Recovery House, Hearthstone. Mirror Inc. Willow Domestic Violence Center. All right. Well, we have come to our last but not least, Van Gogh. I do see Kristen here from Van Gogh. And Elijah, welcome.
Hi, my name is Eliza Darman, and I am the Development Director here at Van Gogh. And Kristen Malloy is our Director of Programs, and she's here as well to answer any questions. I know that many of you are familiar with what Van Gogh does, but there's also some new people here, so I thought I'd do a little program overview and then get into our request. For over 20 years, Van Gogh's offered an innovative and creative solution to meeting the needs for at-risk Douglas County teens ages 14 to 24. We're an arts-based job training program operating in two programs, the JAMS program for youth that are enrolled in school, and then the Arts Train program for out-of-school youth ages 14 to 24. To work at Van Gogh, youth must qualify on one of these factors, although it's typically more than one. Either living in poverty, having an IEP in school, a mental health diagnosis, or being involved in the court system, whether foster care or juvenile justice. So our programs are preventative in nature because they address the entire person. We have a very holistic approach to our job training programs. And also they occur during those often troublesome after school hours. Having two teenage girls, I can identify with this time frame. So youth apply and are hired to work. It's often the first job that they've ever had, which is wonderful that they get to work with Kristen and the program team on establishing good workplace habits and this learning that punctuality and attendance are very important. All of our goal with everything that we do with the holistic approach is creating self-sufficient individuals and citizens of our city and county. So we partner with USD 497, Bert, Nash, the Shelter, Court Services, DECA, and other community providers to complement rather than duplicate services. And also while here, their job is to make art. They benefit from those that amazing creative healing power of making artwork that is then sold into the community where they get to feel proud that their artwork is all around town and someone bought their art or they were part of a mural, and so they can feel recognized and acknowledged for those things. Let's see, we've had a long-standing partnership with the city. My records go back to 2005. And this year we're asking for basically a flat amount. What we've asked for similarly in the past couple of years, $31,000. $9,000 of that goes to general operating funds, and then $22,000 for staffing. So that would help with our social worker who implements the programming and the alcohol prevention services. As we look to 2021 and the persistence of COVID, we do employ 3 full-time licensed mental health professionals, which we feel will really be working very hard to address what we're all seeing as the 4th wave of this pandemic, the mental health pandemic, which is, likely to follow, but truly already there. We're already seeing this. So, our families and our youth are often living in households where it's paycheck to paycheck, and a pandemic, exacerbates this instability. And so often our youth are even helping contribute to the family's, bank account with their paycheck. This year, I'm really proud to say that as of December 1st, we've paid $94,936 of youth wages. So that money is in the pockets of our youth. And this money, that we get through the city is a stamp of approval, and it allows us to leverage federal funds through the Department of Labor and the Workforce Investment Act, which does pay youth wages and staff wages, along with, regional family foundation funding. So it's been a great partnership with the city. We've worked with the city for a really long time and are very appreciative of this, partnership. So does anyone have any questions for me? Kristen's available to answer more program direct questions. Oh, one other thing I wanted to say is that, since the spring and summer, we created a very comprehensive safety and protocol plan for our youth to be able to work here on site. While we did do some telemental health and we did do work at home projects, and we can do those, we just saw the great need for youth to be able to be with us here on site. So, they're here now. They all have like a 12-foot square, kind of their own little island and their own art supplies. So we're not cross-contaminating anything. We're doing prepackaged snacks. And so we are making it work. And seeing them face to face and having the ability to check in, not just through a screen, which, hey, we might have to go back to that at some point too, but it's just been fabulous. So we're using every square inch of our building. So yes, well, thank you all. And I'm here for questions, and Kristen is here as well.
Your Roselyn Chair. Thank you so much, Eliza. Sure. Questions from the board? Well, I don't see any questions, and I don't have, you actually answered the questions that I had in my mind, so I don't have any additional questions either. So thank you both so much for being here. Kristen, did you want to add something?
I just want to go ahead and certainly reiterate Eliza's expression of appreciation for the longstanding partnership we've had with the city, and we really appreciate your time and all of the careful review of the application. So thank you guys so much.
Thank you.
Thank you.
Mm-hmm. Okay, well, that brings us to the end of the presentations and the guests that we have present. And so I'm going to go back to the agenda. So we are at agenda item C1. So this is, sorry, Leah Roselyn Chair, I think I forgot to say that when I started talking. This is my first time doing this process over Zoom. In the past, we have sat in a room together and utilized a shared Excel spreadsheet where we would play with numbers and have ongoing discussion. And so I know Danielle's screen is off. Danielle, are you here or?
Apologies, I did not.
This is Danielle Bushcutter, staff liaison. I apologize. we will get the video. I'm getting the video back up and running. So yes, I am still present. And I do, if the board is still interested in having kind of that shared spreadsheet that has been utilized in the past, I do have that available. If that is something that you are interested in, I can get that pulled up, share my screen, and you all can kind of go through that process as you have done for the last couple years. So happy to do that.
This is Leah Roselyn, Chair. And thank you so much, Danielle. Just curiously, have other funding boards utilized something different during Zoom, or is that what you would recommend as a process?
Danielle, Bushcutter Staff Liaison. The other advisory boards that I am familiar with they each approach it slightly differently. So the other advisory board that's kind of going through a similar process right now is our Affordable Housing Advisory Board. They do it a little bit differently in that they kind of went and used the model we used to use with the 2 meetings, where meeting A would be strictly applicant presentations, questions, those sorts of things. Each advisory board member would kind of put together their recommendations. Staff would compile that, put together kind of that average amount, and then they would come back at a following meeting. So that's how they have structured it. I think with you all, I think it's still possible to kind of do a version of that where I'm still happy to kind of share my screen. I think functionally it'll work similarly to what you have done in the past, even though we're not all in the same room. Everyone's faces will be really, really small, but I think that probably would be my recommendation, just to make sure that you go through, answer any questions that you may have on any of the other applications, and then I can go ahead and share my screen, and you guys can start kind of putting in dollar amounts and kind of seeing where everything kind of shakes out.
Leslie Roselyn, Chair. Thank you so much, Danielle. How does that sound to the board in terms of process? Danielle bringing up her Excel spreadsheet, going through, seeing thumbs up, nods from everybody. Okay, great. Let's proceed with that. So the applications, I would propose just to discuss in alphabetical order according to agency. Is that okay in terms of process with the board? Okay. So let's start with Bert and Nash. First, want to open it up just for discussion. And in the discussion, if members have recommendations for what they would like to add as a placeholder funding amount, I would recommend going ahead and do that. I would recommend that we go ahead and identify placeholders for all of them through our discussion, and then come back after we have finished talking about all of them, sort of see where we land, and then make adjustments after that. Is that good with everyone? Any concerns with that? Okay. All right, so let's start with Bert Nash then. So we heard from Stephen, discussion and recommendations from the board.
This is Peter Carter, board member. As just a starting point to try and get things rolling in a generalized fashion. You know, I hate the use of broad brush rules, but what I did in compiling my recommendations, which I've already done for the entire group, is to start with a 6% reduction to everyone, and then you adjust based on that as a starting point. So, you know, if we've got a 6-point-something% reduction, that at least gives us a starting point. And in the case of Bert Nash, the end result would be about $288,000, which is pretty shy of the 390 they were looking for. But, you know, that we're not in very good times right now.
This is Tim. I actually compiled the list the exact same way. Coming down, when you cut it exactly 6% down from everyone, you get the 691,840, which is, you know, $160 off the allotted budget. So I think that's a good idea to start at that point, because money's low and we've got to start with what we got.
This is Leah Roselyn, Chair. Just, sorry, Ethan, please go ahead.
Thank you. So I was thinking about this as well. And the one concern that I had as I thought about this with an across the board 6% decrease is that we had organizations come, I think, to our last meeting and talk about how, you know, that's not really ideal for them to have a 6% cut in the grant amount, because they're expecting certain amount of money for personnel or operating expenses, et cetera. So I think really we'd be, you know, hurting some of these organizations by not giving them the full amount, giving them this like piecemeal where they have to find a way to make up the difference. I think it's better, you know, if we're not able to fully fund some of these programs, I mean, that's a really hard decision to make. But I mean, I think that's kind of where we're at given the resources. I don't know. I just don't want to be a burden on these organizations while they're doing the great work they do.
Yeah, Peter Carttar, board member, I absolutely agree with you, Ethan. My recommendation of the 6% is a starting point. One of the critical decisions in all of this is, you know, Willow, who spoke to us at the beginning of the year and was saying, if you can't give us 31,123, give us nothing. And the really heartrending part of this whole decision for me is, if it's all or nothing at a time when we're at best we're cutting everybody 6%, one of the critical decisions that we will have to make after I would apply the 6% cut to everybody, see where it leaves us, and then say, okay, what about Willow, who says 31,123 or 0? So that would be kind of the second step.
And this is Tim. I agree with exactly what you're saying there, because I mean, at least for starting point, everyone's got to be looking at a cut, looking at the numbers that we had last year and what we have working with right now for a starting point.
This is Joda, board member. See, I agree with that. As much as I would love to give every single agency everything they need, we just can't do it. We couldn't do it last year. We certainly can't do it this year. I would recommend starting with the 6% and just taking Willow out of the running completely, not give them anything. And I support Willow, but I can see their point. We just can't. We can't give everybody what they want. And so if we can't give everything to Willow, then I just don't think we should give anything to Willow. And then use those funds to help out Heartland or First Step, which I have to say that my priority right now is I'm looking at housing and I'm looking at kids. So housing is such a problem right now, and I think that's just going to get worse. So any one of these agencies that also provide either housing or help too, and I know Willow does, but we can't give Willow $31,123. That's it on my part.
This is Tim, and maybe I missed it. Did Willow say that it was an all or nothing for them?
This is Leah Roselyn, Chair. I feel like the Willow presentation is being misrepresented. what I heard Megan articulate to the board is to set priorities for funding, to make it very clear of the intention of this fund, and then to prioritize funding based on the goals that are set forth. So in this case, the goals set forth for the fund are drug and alcohol prevention and intervention services. She did say that, it's not helpful when we go through and make just sort of a generalized, okay, instead of prioritizing, we're just gonna take a 6% cut of all applications and treat them all fairly, or treat them all equally, when in fact they're not equal applicants in terms of the goals to achieve enabling us to achieve the goals set forth for the fund. And so I just want to be careful that I did not in any way hear Megan or the Willow saying it's all or nothing for us. I heard her speak to a general framework of funding philosophy that says be clear in the goals and intention of the fund, and then reward the applicants that are actually achieving the goals of the fund. And so I guess I just wanted to make that clarify what I heard before we continue the conversation, because I don't want it to be misconstrued, or at least particularly since they're not here and there were 2 board members that weren't here for that presentation. I heard something different.
Peter Carter, board member. Again, Leah, I understand what you're saying. I agree with what you're saying. What I am advocating at this point is the first step before we talk about the priorities. I mean, just putting a number down as a point to vary from. And as I mentioned before, the next decision is, the groups that, well, I have also listed, who is providing a service that is, prevention and remediation and Willow, of all of the groups that we are dealing with, they are frontline emergency. So, that is part of the longer term discussion that I hope to have with everyone.
This is Tim, and Lee, thank you for clarifying that, because I'm new. I didn't hear the presentation. It had made it sound like it might have been all or nothing, which changes a lot of things where money could be moved around. So I'm still fine with going the 6%. I like the idea of going 6% down the board as a starting point.
Yeah, Peter Carter, board member. What I heard Megan saying was that if we were thinking that we could not fund the entire amount, that she would rather have nothing. And I think that was pretty explicitly stated. I understand the rationale, but it makes our next discussion pretty critical.
This is Leah Roselyn, Chair.
Sorry, go ahead, Joda.
I wanted to ask hey, Joda, I'm sorry, before we proceed, could board members raise their hands virtually when you want to speak, just so I can keep track of sort of the order of speakers and make sure that everybody has an opportunity? Thank you. So Joda, and then we'll go to Christopher.
I actually heard the same as Peter. Don't get me wrong. Once again, as a CASA volunteer, I have seen how good the good works of Willow, but I understood the same. And Leah, I think that you're really coming from, you have a better understanding and see between the lines of some of the presentations, just because that's what you do for a living. That's how you see things. And I think that's great. It's nice to have that perspective. But I heard Megan say the same thing as did Peter, that it just is not helpful if they can't get the whole thing, then it's easier to make the planning for them, easier to set out a budget to not get anything so that they know they have to go looking for money somewhere else. That's basically what I heard also.
Thank you. Christopher. Chris.
This is Chris. I have a question on the well, I suppose, since I wasn't part of that discussion. In reading their application, it seems like what they're proposing to use this money on is a new program. Is that correct, or is this an existing program that they have? Because if it's a new program, then I can understand that point of if we're not going to get the full 31, then we're not going to do the program, and we'll try to find full funding for this new program in a different way. And my other question would be is the 6% I agree with, but the only thing that I have somewhat of an issue with is we do have an applicant for Mirror Inc. and that just completely takes that off the table of a discussion. But I have other questions on Mirror Inc. anyway, so I'm comfortable with a starting point of a 6% cut from the prior year and then working up or down from there on anybody.
Thank you, Chris. This is Leah Roselyn, Chair. And to answer your question, it is not a new program. This is a continuing program, the art therapy program that we funded in the past. Any other comments from the board about a starting place? This is Leah Roselyn. So I took a little bit different approach, and I also have my spreadsheet filled out with a balanced budget. Rather than an across-the-board reduction in the 2020 budget, I prioritized the programs based on my read and the evidence of their ability to achieve the goals for this drug and alcohol fund. Based on that, and knowing that we couldn't, fully fund the increases, I left a balanced budget for those programs that really, again, in my read and according to the literature, really do help drive those outcomes that we want. And so for this reason, for Bert and Nash, I recommended a flat budget from 2020 at 307. But so it sounds like though that the majority of board members want to start with a 6% reduction across the board from 2020, but I did want to offer that other recommendation. I saw Chris's hand. Go for it, Chris.
I support a 6%. I did it probably 4 different ways, so I'm comfortable starting with the 6 point as a discussion point. But I mean, I did it probably 4 different ways to balance it, and to say one organization is less successful in a lot of ways, or is less impactful than another.
This is Leah Roselyn. All right. Well, let's. Are there any disagreements with starting out that way? Okay, so it looks like Danielle has already gone and entered what those numbers would be with a 6% reduction from the 2020 budget. So, Danielle, I apologize. I can't see the total line at the bottom. Is there any way that I'm assuming it's, so we have 160 left. From 6%.
This is Danielle Bushcutter, staff liaison. I am happy to make it smaller. I don't want to make it too small so that so you can't read it, but this is a good indicator of what is remaining. The other thing that I would say is we've kind of used a version of this in the past. This box typically goes up and down quite a bit as these discussions go on. So the one thing I would share with you all is that particularly as you're starting out these discussions and kind of going through your kind of initial maybe recommendation to not pay too close attention to this. Obviously, if you have, you know, $1 million in there and fully fund everything, that's a lot harder to get back to the 692 figure. But just want to kind of note that as you all kind of go through this. I did include, based on the board discussion, what kind of that 6% reduction would look like, just so you all, if you didn't do that, are able to kind of see what that looks like. So I will just be typing away as I hear discussion, but if I type something incorrectly, please let me know. I'm trying to kind of read body language, which is a much harder to do virtually than it is when we are all here in person, and I can see all of the head nods, either yay or nay. So bear with me a little bit.
Leah Roselyn, thank you so much, Danielle. So to move us from this point, I would recommend that now we begin discussing, well, actually, let me open it up for a question. Would you all like to go down the list and discuss each applicant and adjust recommendations that way? Or would members like to propose some recommendations, increase or decrease? Are there any agencies or programs that board members are recommending full funding for? And which process would you like to use? Joda.
I think this is an easy one myself, is the Hearthstone. They ask for so little and they actually satisfy or deal with actual intervention. They provide housing, they help with work, they actually contribute, the residents actually contribute. I like the idea, and they ask for in the scheme of things, they ask for so little. I made a note that I wouldn't fund them entirely, but I would like to see them receive 10,000.
Thank you, Joda. So what I hear from your comment is that you're recommending we should start discussions on agencies that are very much in alignment with the intent of this fund, and talk about increasing those line items. Ethan, please.
This is Ethan. I think I took a kind of a similar approach to you, Leah. And I think, you know, when we were putting the application together, the reason that we included like evidence-based questions and things like that is because those were things we wanted to prioritize. So I just thought, like, would it be useful if we talked about what the priorities are as a group at this point, or what we're really going for? Because, for instance, like I in my recommendations, I recommended not funding Hearthstone because it's not an evidence-based program, and I think some of the other programs on this spreadsheet are more effective or evidence-based. And so yeah, I don't know if a discussion about priorities or values would be helpful at this point, but just my 2 cents.
Leah Roselyn, so I hear Ethan recommending that we discuss how we want to prioritize before we start going down and making line item recommendations, which sounds like a good process to me. Chris, please, you're up next.
I would agree with that. I think that would be helpful to both. This is Chris. I think that would be helpful to both Tim and I to hear what your thought process was when you guys were putting together the application, and kind of what your hopes were. So it may change kind of my initial take of what would be a good investment for the city money.
Great, thank you, Chris. Let's go ahead and have that discussion then. So I heard, sorry, this is Leah Roselyn. So I heard Joda talk about that her priorities were really around housing and youth. So if members could raise their hands, if you would like to offer a discussion of sort of how you're prioritizing, we can start the discussion that way. And Joda, I don't know if you have anything more to say as a starting place or.
No, I was just telling when I looked at these, homelessness is such an issue, and a lot of it is alcohol and drug related. So that was one of the motivators in my own thinking, is which one of these all very worthy organizations and agencies who can help not only with the alcohol and drug intervention, but also providing some housing at the same time, like First Step House and Willow for that matter. All three of those actually do provide some housing. And I know that there are other agencies like Ballard, for example, that help with social services and help provide a connection between, and Hearland, be able to provide social services and direct people to a place where they can find housing. But basically those were how I was looking and evaluating some of these agencies. I'm game for anything because I personally am not a real logical person. I'm more of an emotional person. So that was my motivation. That's it. That's all I really have to say. Except I am going to step away for a second.
Thank you, Joda. So if it's okay, I'm just going to call on board members to speak to how they are personally prioritizing. And would also just point everybody to the charter ordinance in terms of the goals and intent of this fund really is to be directed towards drug and alcohol prevention and intervention. This is our first year of having general funds separated from special alcohol funds. So in the past on this board, it was a little bit more muddied in terms of we were also looking at supporting general social service agencies with less clear priorities. And again, in my read of the charter ordinance, this is very specific towards drug and alcohol prevention and intervention, distinct from the more general social service fund. And so when I reviewed the applications, that is how I set priorities, was looking at these funds are coming in from alcohol taxes. The voters approved it to support alcohol and drug prevention and intervention. And in my mind, to really honor the charter ordinance and taxpayer dollars, it's imperative that we prioritize the programs that achieve those goals set for. So that's how I'm prioritizing. Tim, let's go to you next.
Okay, I got, I guess, a few points. The first one, I don't know if I'm comfortable raising anyone's number past last year in this case. Then my next thought goes into what you're talking about. I am newer, but as I read the charter, exactly, it goes to drug and alcohol programs. And then this is a question for anyone who knows. See, I look at Willow Domestic Violence Center and just see art program. Can someone explain to me what that is? I wasn't part of hearing what they had to say, but to me, that's the first thing that strikes me on the list of, okay, how is that directly benefiting the alcohol and drug prevention? And then for me, it would be a stair step of what is for drug and alcohol prevention, and then what's doing social services, which are obviously important, but when it comes to what we're talking about, there has to be a priority there first. But I do have a question on what their art program is and how that relates.
This is Leah Roselyn. So the art program is an art therapy program. It is a licensed art therapist that works with the survivors that they work with. And it's just a therapeutic modality. So although it's not targeted for drug and alcohol prevention, I think it has indications for, drug and alcohol recovery. Are there other board members who want to speak to other aspects or a greater understanding of that program? Okay. So I'd like to go ahead and hear the rest of the members' prioritization. I think that's a great suggestion for guiding our discussion. So Ethan, would you mind, or I see Peter unmuting. So Peter, let's go to you next.
In looking at the Peter Carter board member, in looking at the application, it is not the art program that the application is for. Last year, we gave Willow money for the art program, but in going and looking at the application, let me make sure, the program for which the funding is being requested this year is a housing case manager, SUD specialist, which is explicitly, dead on center exactly what we want to be doing. Someone correct me if I'm misreading this, because I think the table that we got this morning is not accurate in that.
This is Leah Roselyn, Chair. Thank you so much for pointing that out, Peter. You're absolutely correct that the application is for something different this year, and so the table should be updated. Yeah, so the case manager would work on housing stability focus.
And Leah, if I could add, so the housing case manager, SUD specialist that Willow wants to add is exactly an emergency response kind of a person in this particular location, but it is also a discrete individual, 100% of which is being asked for in this year's funding. So when they are asking for all or nothing, what they are saying, what Megan was saying at the beginning of the year, I believe, was that she wants to fund this individual 100% from this funding. And if she can't fund a whole person, she can't fund, 83% of an individual. So that's the rationale behind her all or nothing request.
Thank you for that careful review, Peter. I really appreciate, this is Leah Roselyn. I really appreciate your attention to that. So without getting stuck on Willow, I just want to, again, make an opportunity for the board to talk about any priorities that they have as we're reviewing this. So Ethan, did you want to speak any more to what you're looking at?
This is Ethan. Yeah, the only thing that I would add is that when considering my recommendations, I also prioritized the charter ordinance, I prioritized evidence-based programs, and I prioritized making as few cuts to last year's funding as possible. And then additionally, where we did have to look at cuts, I tried to look at, would it be possible to just fund the personnel portion? That way we can at least give them the position fully, and then maybe they can make up whatever else they were asking for some other way. But if we can at least give them that position, then I feel like that's probably the most important part of implementing the program. So those are the considerations that I made.
Thank you, Ethan. I believe that Chris might be the only one we haven't heard from. Chris, would you like to speak to prioritization at all?
I was very similar, that I was prioritizing what the ordinance said and how the application spoke, how it would directly impact something within the ordinance.
Thank you. Have we heard from everybody? Okay, this is Leah Roselyn, Chair. So, okay, so I did I know we're moving out of order, but I heard Peter, so since we've been talking about the Willow, why don't we start adjusting the numbers for that line item, unless there's any concerns with that? Chris, please.
This is Chris. I would probably agree that they would get a zero funding. I'm not. One thing I also looked at it was whether we're 100% funding something or not, and I don't know that in my mind that we want to be 100% funding any one component of a program or a program in its entirety.
Tim.
I have to agree with that as well.
So I'm hearing a recommendation to put Willow in at 0 for this new program. I heard Peter, Chris, and Tim speak to that. Are there any concerns, or Ethan and Joda, would you be in agreement with that recommendation?
This is Joda. I would be in agreement with that, as much as I hate to say that. I would agree that we just can't fund that new program or that new staff member.
This is Leah Roselyn, Chair. Okay, thank you all so much for your great discussion. Let's go ahead and put them in at 0 for now. It looks like Danielle already did that because she's a freaking rock star. What program would members like to go to next? Are there others that are recommending a 0 or full funding? Or flat funding, I should say. Ethan, please.
This is Ethan. I would recommend flat funding for the Bert Nash RAP program. I think that just given everything going on in the world today, and especially with kids not being able to be in schools, I think mental health supports are, really important right now more than ever. And I think this seems like a great program. It's accessible in all the public schools, and I think it'd be a mistake to cut it, especially at this point in time. So I would recommend flat funding.
Thank you, Ethan. Joda, I see your head nod. Are you in agreement? Okay.
Yes, I am in agreement with that. It is a very good program. I'm curious, however, about what kind of services they're providing. I suppose he spoke to this about telehealth, or because so many of the kids aren't in school right now, or only doing it remotely. Isn't that what's going on right now? I'm afraid I kind of stay out of the loop with the school, what's happening with the USD 497. But I would agree. I think it provides a really important service to our children.
This is Leah Roselyn. Yeah, the schools are actually in hybrid mode now. So some students are attending in person and some are doing online. Are there any concerns or disagreements about putting them in with flat funding as a placeholder for right now? Okay, it looks to me like the board is in agreement to go ahead and put them at 307 as a placeholder. Are there other programs that members would recommend 0 or flat or full funding for? This is Leah Roselyn, Chair again. I would recommend full funding for both the DECA programs, First Step at Lakeview and the Lawrence Outpatient Treatment Services. Discussion about that. Discussion, disagreement, agreement.
This is Joda, board member. I agree with that. I think they need full funding.
Is there any disagreement about putting that in as a placeholder for right now? Tim, please.
I don't have a disagreement right now, but is there any way we could scroll down and just see where the rolling numbers are as you type those in and see how far off budget we are? Is that possible? If not, that's fine. I can do the math here if not.
Danielle Bushcutter, staff liaison. Yes, I can scroll down a little bit.
I play with the font a little bit to make it so it all fits on one screen because we're really close. But this is our current gap right over here in the I column.
Thank you.
You're welcome.
This is Leah Roselyn. Danielle, I wonder if you could just hide the willow, and that way we could see all the cells that we're still working with, maybe? Perfect.
Got it.
Thank you. Okay. Other recommendations for flat, full, or zero funding?
This is Ethan. I would recommend zero funding for Big Brothers Big Sisters. I feel like it's a really small amount, and I would hope that they would be able to make that up somewhere else. And I just think that when we're talking about intervention and prevention, that's more of a side effect of the Big Brothers Big Sisters program, whereas some of these other programs are dealing with youth and substance use disorders more directly.
Thank you, Ethan. Joda, did you have a comment?
No, I agree with that, sadly. I know that Big Brothers Big Sisters have had a difficult time recruiting volunteers, and that it's particularly hard right now with COVID. But I would also agree with Ethan that we should probably not fund them this year.
Thank you, Joda. I see a couple head nods. Is anyone in disagreement at this point about putting them in at zero as a placeholder? Okay, let's go ahead and put them in at zero as a placeholder then. Additional recommendations for flat, full, or zero funding? Okay, well, hearing none, I would recommend then we just go down in alphabetical order and discuss the ones we haven't gotten to. So Boys and Girls Club of Lawrence Prevention Program is a part of their sort of health and wellness programs. Thoughts and discussion and recommendations for movement.
This is Ethan, and I apologize for jumping on it so much, but and this is more just to start discussion. Is I honestly, reviewing the application, I felt kind of similarly about this program as I did about Big Brothers Big Sisters. I just don't know. It seems like, again, it's more of a side effect than the intent of the program, but maybe that was just my reading of the application. And obviously it's a lot of money, so I don't know how others felt about this application.
This is Leah Roselyn, Chair. Yeah, I struggled in the similar ways, Ethan, in that it is a part of their general after-school programming, and certainly they do have programming regarding particularly vaping and smoking. And other drug and alcohol prevention, but it is more generalized in my read as well. So I do struggle with that one, and would love to hear other opinions from the board. Other thoughts? Tim, please.
I mean, just hearing that, I'd propose putting a placeholder in to get us exactly the 692 and see how we all feel. That'd be dropping them. What is that? 8,000. Where's my math at? 8 and some change.
We're all waiting to see what that turns out to be. Go for it, Danielle. Okay.
I mean, if we're, sorry, this is Chris. If we're having that type of logic, I think we would probably have to look at Ballard community centers as well, because they didn't necessarily speak directly to it, but it is part of the overall program.
Yeah, go ahead, Leah.
No, please go, Ethan.
This is Ethan. I was just going to say I had similar struggles with all three of these programs because they do seem to kind of straddle that line between, is this for the is this suited for special alcohol funds, or should this be general fund or funded through the general funds? Thank you.
I apologize, Tim, please.
And my recommendation to move the Boys and Girls Club, because I'm looking at it strictly financially at the very moment. I'm leaning on a lot of you because, as I said, very new, didn't get to really hunker down and look at all these really in depth. I got the general overview, but I think now having it, I mean, we're not all way too far off, and now we have it nice and balanced. Now it's an easier way to start shuffling smaller amounts around to where we feel comfortable. But now having a balanced budget, it's great that we're there right now.
Agreed. Thank you, Tim. So with that, I agree. It's a good time to start shuffling things around. If there are any if there's anything glaring to board members that you would like to make recommendations for adjustment. And I think that although we haven't discussed all of the applications yet, we can just sort of pick up on the ones that we are interested in discussing or moving. This is Leah Roselyn, Chair. So I would recommend keeping Van Gogh flat from 2020. They work with, incredibly vulnerable and high risk populations. As they spoke to, they have licensed social workers on staff that work extensively with the youth participants. And I just think that it is such an incredible prevention program for those high-risk youth to give them meaning and purpose and support. Peter.
Peter Carter, board member. I think that can be said about all of these groups, and perhaps to Tim's point, now that we have a point at which we are balanced, at the same time we say, well, I think we should fully fund X, we might add who we want to take it from, because that is exactly where we are now.
This is Leah Roselyn, Chair. I agree that it's nice to be at a balanced budget, but I don't think we've discussed all the applications. And so in fairness to those applicants and programs, I don't just want to stop because we have adjusted a couple and happen to be balanced now. Particularly in looking at it, the impact of on a small organization like Van Gogh to lose, although the numbers aren't as large. I'm considering that as well, other potential sources of funding and the impact on the organizations for the decrease. But I'm sorry, Joda, please.
That's all right. And also we haven't factored in the mirror, it was professional, what was it before? Professional treatment services before. I think it's been around a little bit, but we haven't discussed that at all. I mean, it's not in our balanced budget. There's nothing there. So you're right, we haven't gone through all of the applications yet. So that's my only comment.
Leah Roselyn, Chair. Yeah, let's go ahead and talk about Mirror. We didn't have any representatives. They have not received Lawrence special alcohol funding before. I'm not familiar with the organization. I did try and do some research on the organization, went to their website, looked at their staffing, their framework, carefully read their proposal since I wasn't familiar with the organization. So yeah, I'm interested in hearing. So I guess for me that I want to be very careful in tiptoeing because of what I do professionally. I have the opportunity to, work with a lot of the social service providers, and it did raise a flag for me that they're not sort of a part of our social service network. The biggest ping for me was in their statement of equity. They were not able to speak to in any way serving marginalized BIPOC, LGBTQIA2+ communities. Their response seemed to indicate a complete lack of understanding of what was even meant by that question of providing equitable services. And since we're prioritizing that's really giving me pause. Tim, I saw your hand up.
I mean, when I got this last night, that's the one that just shot out at me. And it's actually the first one because I'm familiar with a lot of these, but had no idea what they were. And since they're asking for such a big number, and actually looked at theirs, and I didn't feel comfortable with what they had. And especially just being the year it is, we've got other people that have been here a long time. I'm fine with cutting them out. And yeah, thank you.
Thank you, Tim. So I saw a thumbs up from Ethan. Are there any disagreements about leaving them at 0 for now? Okay, seeing none. Are there any other programs or agencies that members would like to discuss? In doing a review of where the numbers are landing now, how does that sit with people? Does it seem like we're in a good place? I see some head nods.
This is Chris. My only uncomfortableness is maybe Boys and Girls Club at this point, because if we were saying, like I mentioned, if we're saying that it was kind of a peripheral aspect of what their program is, then we need to make sure that no other applicant is that same way, because they're being penalized at a higher percentage for being a part of their overall program and not a specific program that's speaking to drug and alcohol. And they're taking the brunt of that aspect of it.
Thank you, Chris. Other comments or thoughts about that?
I kind of felt the same way. And so as I saw it, like with DACA, those are ones that I'd feel like you could strip maybe 1,000 or 2 off of each one to put that back in the Boys and Girls Club, because that was a dramatic drop for the Boys and Girls Club as well.
This is Leah Roselyn, Chair. Ethan, please.
This is Ethan. I would be hesitant to cut the DECA programs at all. I think those are really well known, really strong. I mean, First Steps at Lakeview is like one of the only SUD programs for pregnant women with children in Kansas that I know of. And I would just really hesitate to cut that. But we could maybe spread. So if we're subtracting the 8,460 from Boys and Girls Club, could we like split that maybe and subtract, you know, the 4,000 of it from somewhere else, perhaps, such as Ballard, where we kind of had those similar concerns of whether or not they really met the charter. And that's just one idea. We don't have to do that.
Tim?
I'm fine with what you're saying, Ethan. Like I said, you guys have a little bit better knowledge of each of these programs than I do right now. But I do agree with, who is that? Christopher there, that it's a big cut to take for Boys and Girls Club that has established themselves and do a lot here.
This is Leah Roselyn. So I would also say that Hearland would fall into that category. And again, I utilize more of a lens of equity than equality. And for me, that takes into account their ability to raise funds, their overall support and overall operating budget, and knowing that there is not the same impact of those cuts on those organizations and their ability to provide those programs. So for instance, the Boys and Girls Club has almost a $6 million budget. They receive state, federal, private donations. They also have fee for services. So they have ways of generating that income, as do some of the other agencies. But I guess I just feel compelled to note that some agencies' ability to raise those funds and make up the difference is substantially different than others. And so I guess for that reason, I prioritize keeping more funding to those small organizations that are less well known, that don't have a whole, state and national network advocating for them, grant writing for them. The Boys and Girls Club has a team of development professionals. It's much different for a small organization to try and make the same impact. Tim, please.
Oh, no, thank you for that. I can agree with that as well.
So are there other recommendations for movement? So Danielle, oh, I'm sorry. Ethan, I just had a quick question and then we'll come back to you if that's okay. Danielle, what is the percent now that percentage change for Heartland, or I'm sorry, Ballard, Heartland, and the Boys and Girls Club, just so I have a better understanding of what the adjustments were?
Give me just 1 second and I will get a new column created.
Thank you. Ethan, please.
This is Ethan. I was just going to ask, are we all comfortable with not flat funding Van Gogh? Because I do think it's important for the city to support that program, and it's a great program.
This is Leah Roselyn, Chair. I see head nods, but I'm not sure if the head nods were in regards to comfortability or importance. So are members comfortable with their cut, or would members like to move them back to flat funding from 2020?
This is Joda. I'm sorry, I didn't raise my hand.
Go for it.
I am happy with cutting them. I know it's a great program, but you know, in the scheme of things, it's a relatively small group of people that they are involved with, and it's very focused. I don't know. I would be happy with the cut to 20, whatever it is, the 6%. That's it.
Thank you, Joda. Other comments?
This is Chris. I think 17% to Ballard is probably, speaking to equity, that's probably inequitable to what their overall budget would be, to what this funding would mean to them. And if we're doing that on basis of the same reasoning as Boys and Girls Club, then we shouldn't see a 10% only for Boys and Girls Club and a 17% cut for Ballard.
This is Leah Roselyn. I completely agree. And yeah, seeing the percentage change is very helpful for getting that understanding. So, so do you have a recommendation for adjustment, Christopher or Ethan?
This is Ethan. My recommendation for adjustment would be if we need to increase funds to Ballard, pull them from the Alcoholic Recovery House. Again, I just had concerns with their application. I didn't feel, while it is a direct intervention program, I didn't feel that it was maybe up to the level of some of the other programs, and just also not evidence-based. And I just had some concerns about, I don't know, I guess the quality. But that's just my thoughts.
Thank you, Ethan. Peter.
Yeah, the Peter Carter, board member. With regard to that, I think that the size of the organization and their ability to put out, you know, the evidence-based models and the like, you know, they don't have that capability just because of the nature of the organization that they are. And you know, there's this the dental group that we were talking about last year is very similar in that it does really good work, but that work does not involve people who have the flexibility to put together data in the same way that we might be working for. So they're kind of hobbled in that way, but I think they're dead center in what we want to support. So it's a tough one.
This is Leah Roselyn, Chair. Yeah, although they don't show evidence-based modalities, they are a residential recovery house for men that is really needed in this community. And they're, you know, in such alignment with the goals of this funding that I would recommend flat funding for them from 2020. It meets the need of housing, which, although not the intent of this particular fund, is a community need, and it really meets that intersection of meeting two critical conditions intended for, plus housing for men, which is in high demand and low availability. So would other board members be amenable to putting them in at 9 for placeholder?
This is Joda. I agreed. Their applications last year, I mean, it's always been kind of funky just because they don't have the time or even the skill probably to put together an official application. But none of this is, no one's going to have success in
alcohol recovery unless they have stable housing. And so that's one of the reasons why I support them. And I would hope that they would get just flat funding for this year. And I know I'm jumping to another one, but I also wanted to talk about Ballard. People talk, that's such a big cut, and it is. But Ballard also relies on some outside fundraising events. And they haven't, of course, so many people have not been able to hold their events as they have in the past. And certainly Ballard is one of those where they have had events that generated a lot of donations and a lot of their monies to be able to function efficiently. They do provide a lot of help to the community. So I think that's too drastic of a cut for them, 17%. So those are my observations.
This is Leah Roselyn, Chair. Yeah, I agree. Our rationale for why we would cut them 17%, almost double any others, is I'm very confused by that rationale. So maybe somebody can help me understand if you are advocating. Okay.
This is Chris. Danielle, do we have, I'm not familiar with the Hearthstone. Do we have a 990 or anything beyond just their application?
This is Danielle, Bushcutter Staff Liaison. They do not have a 990 or a financial audit or annual report. It is a pretty small organization as a whole, so they do not have to fill out. It's my understanding that they don't have to fill out the 990, and they do not have a financial audit that they complete on an annual basis either.
This is Chris again. Does anybody? There's board members here, committee members that are that know this organization. I guess I'm somewhat uncomfortable investing city money in an organization that we haven't seen any financial information from that at all. Even though it's not necessarily required, they probably do have to file a 990N, which is a small, simple form, but at least some financial information to know, are we 100% funding this organization? How is the money being spent? It just makes me somewhat uncomfortable not having some financial information to make a decision on that investment.
Peter Carter, board member. They are a neighbor of mine. I've lived around them, from back when they were Beth Stone Center. These guys have, they're great neighbors. They've done really good works through the years. They are not set up like, it's not a corporate structure by any stretch. I would really be reluctant to change our support for them suddenly. Although I wouldn't be at all opposed to communicating to them that we would like something more. But, in the application process, one of the questions is, have you ever submitted a 990 and have you ever been audited? And they answered both of those questions that they have never done that, but because like Danielle said, they're a small enough organization, it's just not a requirement for them. So they kind of depend on those of us who know them and have been around them and to give them support.
This is Chris. I think that every non-for-profit has to file a 990. It's just what 990 they actually have to file. Either file a 990N, EZ, or a full 990, and maybe a PF. But so some 990 of some form would need to be filed if they're a qualified not-for-profit organization.
This is Leah Roselyn, Chair. I apologize. I am looking at GuideStar right now to see if they're even in there. And Chris, I really appreciate you drawing attention to this. You're absolutely right. It does concern me as well that we don't have any financial records or oversight of that. Peter, did you have another comment?
Oh, I was hoping that Danielle would have something along those lines to confirm, or, no, I guess no further comment.
This is Joda, and I have just one comment. I would still like to fund them for this year, but tell them that for next year, they have to provide some kind of financials to show what that money is being used for. Like Peter, just to cut everything this particular year, when so many people are losing housing, plus turning to alcohol and drugs to numb this horrible stuff that we're going through right now. I think that it would be a real disservice to our community, actually, to actually cut them off, but let them know that going forward, they have to submit some kind of financials to be able to make application again. Those are my observations.
This is Leah Roselyn, Chair. So I did find them on GuideStar. They are required by law to submit an IRS Form 990N. And the last time that they submitted or filed a 990 was in 2009. They show no paid staff, so it looks like it's a peer recovery, peer-led house. That does give me pause, though, just in terms of, Danielle, can the city fund organizations that are out of compliance in that way?
This is Chris. This is Chris. I think at that point in time, that was probably a 990 EZ at that point. I don't have GuideStar up right now, but my guess would be that's a 990 EZ, which they've changed the rules since 2009. So while they may have had to file a true 990 EZ because of their total gross receipts, after that, the amount of gross receipts changed, and then they wouldn't necessarily be required to file a 990 EZ, but just a postcard, a 990N. So GuideStar, I don't believe, uploads the 990Ns of those organizations, since it's just literally just a piece of paper that says who the board members are, what their name is, and whether they had more or less than the gross receipts that is allowed to file a 990N.
So there's no way then so you're saying that GuideStar doesn't have a link to those forms? They also don't list board members or financials on their website. So in any case, if they're indicating on the application that they haven't filed one, then
This is Chris. The only way that you would necessarily be able to tell whether they're in compliance is using the IRS charity search database. And you could actually find whether, if they haven't filed a 990N like they were supposed to, then it would show that they are not qualified not-for-profit organization.
Thank you, Chris. Danielle, what is your guidance on this?
This is Danielle Bushcutter, staff liaison. The IRS requirements for nonprofits specifically is a bit out of my expertise in terms of being able to give you an off-the-cuff kind of response. It's something we could certainly look at. It's something we could certainly reach out to that particular agency and get a better understanding of the exact structure that they have in place. It's not something that I am familiar with enough to be able to provide, I think, you all really good guidance today in terms of how that agency in particular is structured. So I'd want a little bit of time to be able to go back and look at some of that information and reach out and have some of those conversations directly with that agency to answer some of those questions. So I apologize, I can't give better guidance on that, but we can certainly look into it as we move forward based on your recommendation today.
Thank you, Danielle. I'm doing a quick search by their EIN on the IRS database. Are there other comments or thoughts about this, about Hearthstone?
This is Joda. I know they might not, that there might be off the grid, but I know that drug testing supplies are expensive. Like I said, I would still do a flat funding for them and advise them that their application will not be accepted in the future without some financials. But I would not cut them off this year at all. This year would be really, really hard, I think. A lot of these fellows who live there are actually also working and paying a portion of their salary. And let's face it, jobs are kind of hard to come by right now. So I would leave it flat. I wouldn't cut them this year, but I would warn them that, or give them a heads up that going forward, they had to submit some kind of financials with the future applications.
This is Chris. I respect that position, but about it being a hard year. But if we're making cuts to other organizations that have provided information, substantive information as to how these funds are going to be used, and we're kind of the stewards, and the city's the stewards of public taxpayer dollars, ensuring that those dollars get spent appropriately. And we have people that have clean financial records and are filing 990s and have appropriate accounting. And I get that they're a small organization, but being a small organization doesn't preclude you from having financial records together. And you may not have the expertise to do that, but I don't think, again, preclude you from having those records together. So, I mean, I don't know much about them, and I'm sure based off of your recommendations, they do great and essential work, but I would propose that they either we flat fund them with the stipulation that they provide some financial records within a certain time period, or we zero fund them and provide that money back to Ballard and or Boys and Girls Club.
This is Joda. I agree with that they should be flat funded, and tell them that it's basically contingent on their providing some financials. But I just, you get online and you're reading in our Lawrence Facebook pages about, the things that are happening on our streets downtown. And it's nice that there is a place for recovering alcoholics to be, located and get the treatment that they need. So yes, I agree with you, Chris, that go ahead and flat fund them perhaps, but stipulate it with a receipt of their financials.
This is Danielle Bushcutter, staff liaison. I do want to point out
I'm going back and pulling some of their old reports that they have to provide as part of receiving funding for the special alcohol dollars. And they do have an accounting in that report. Again, it's at a high level, but at least of what the funds were used in previous years. So while it is not a 990 by any means, and it is certainly not a full financial audit either, I wanted to make sure that you all were aware of that as well. Just as I was kind of pulling up some of those other documents, and there are some language in the agreements as well related to having some access to some of those financial records. So just wanted to point that out, that we do have some language in our agreements as well as this information here. So I would be happy to reach out to that agency and see what information we can glean from them as well.
This is Leah Roselyn, Chair. Thank you for doing that, Danielle. That's helpful. On the IRS page, it shows that their IRS status was revoked in 2013 and reissued in 2016. It was revoked as a result of failing to file. But it does show that they did file a 990 in 2019, but doesn't have a link to that. So I do think that if that has been completed and filed, and I guess I'm confused to why they didn't submit it. And do think that it warrants just looking into more to get a better understanding of it, because we have the responsibility to, be ethical and legal stewards of taxpayer dollars. And regardless of the amazing program that they do, it is very important that there is a board with fiduciary responsibility that's maintaining oversight, and there's no board members listed. So anyway, I would be in agreement about leaving them at flat funding now, with that stipulation that we need to get a better understanding of their fiscal oversight and financials. Other thoughts about that? Agreement, disagreement? Ethan, thumbs up. Peter, thumbs up. Thumbs up. Let's see, head nods. Okay, so we'll keep them at flat. And Chris, thank you so much. You're an awesome new member of the board. So with that, where are we? We're $540 over. Is that correct? But I see that Ballard is still having a 17% cut. So I'd like to recommend that we put them back at 6%, just to be more in alignment with what we're doing with the other organizations. Now we have 47-ish to work with.
This is Ethan. I wonder if is there and this would probably take a lot of more math than I know how to do, but would there be a way to find a percentage that we could cut all of the programs that are being cut to just make it an equal percentage across the board, now that we've kind of identified those programs that we think is that we're going to make the decision to decrease their funding, but still fund partially?
This is Danielle Bushcutter, staff liaison. I just want to make sure
I'm understanding the ask. Ethan, are you asking basically to figure out what the percentage would be to evenly distribute the remaining reduction amount? Is that your recommendation?
Well, not the remaining reduction amount, but just find a way to equalize the percentages so that each entity that we are partially funding but not cutting all funding, so that it's an equal percentage decrease across the board. That might be too difficult to figure out. I don't know.
Oh, sorry, go ahead.
Danielle Bushcutter, staff liaison. I'm just making sure that I'm understanding. So you're saying basically identify the entities that are already experiencing some sort of reduction and normalize that percent amount?
This is Ethan, yes.
Okay. I just want to make sure I understand. Thank you.
This is Leah Roselyn. I would advocate for doing it a little bit differently. Again, speaking to the disproportionate impact on those small, locally funded organizations that do not have the opportunity to compete for federal grants. I would recommend taking Hearland at a 10% cut, like we did with Boys and Girls Club, and seeing how things flow after that. I see some head nods. Ethan, would you be okay if we tried that as a test? Okay. So now we just have 1290 to adjust. Recommendations for that adjustment, and so I guess my recommendation would either be to split the difference and deduct evenly from the Boys and Girls Club and Hearland, or to look at whatever would be a 6.5% reduction in the ones that are currently held at 6%. What is the recommendation of the board?
This is Joda. Let's look at the numbers, just checking the 6.5% from those who we've already deducted from.
Oh, okay, so now we just have 950 to adjust. So what does the board think about splitting that 950, taking whatever the four, whatever it would be, between Boys and Girls Club and Heartland?
This is Chris. We have Boys and Girls Club at a 10.5 right now versus Heartland at 10.
Oh, thank you so much for noticing that. I didn't see that. So yeah, let's. We're so close. Recommendations for what to do with that remaining 515? What do members think about taking 257.50 off of those larger organizations?
This is Danielle Bushcutter, staff liaison. If we could at least round to the nearest dollar.
It makes the administration of it a little bit easier. So I would request we could at least round to the nearest dollar.
That sounds good to me. Does anybody have a recommendation for how to do that, how to split it? So can we do 258 off Boys and Girls Club and whatever, would it be 256 or? $257.
What was the other half of that, Leah?
Heartland, the 257. Okay, so we're back at a balanced budget. Let's do a gut check. How does this sit with folks?
This is Ethan. I feel pretty good about this. To be honest, there's nothing that jumps out at me immediately as being unreasonable or really out there. So I'm comfortable with it.
Thank you, Ethan.
This is Joda. I think it looks good too. I do agree that we need financials for Hearthstone as much as I adore and appreciate that organization and keeping a place for men who are recovering. I still think we need financials for them.
Thank you, Joda. And just as in terms of process, so Danielle, what that might look like is that, would it be that the board makes a motion for approval as with this information, and then you come back to us later, or do we need to table the action until we have that, or?
This is Danielle, Bush Cutter Staff Liaison. A little bit of that discretion is up to you all. If it is something that you want before you bring forward a recommendation, then my recommendation would be that we establish another meeting so that, you know, we have time to gather that information from the agency and bring it back to you all. If it's something where you all as a board do want to keep the recommendation as identified regardless of that, then I think you can go ahead and make a recommendation today, and we can still get that supplemental information to you at your following meeting. So it's kind of at the discretion of you all and how you want to proceed with that particular recommendation to the commission.
This is Joda, board member. I would just like to keep it the same and then basically ask for their financials and not make the recommendation contingent on having those financials before the recommendation, because frankly, I don't really want to, you know, have to schedule another meeting so close to this one.
Thank you, Joda. So what you're suggesting is to go ahead and make a motion, approve recommendations that would be brought forward to the commission, and then just review their financials sort of as a follow-up.
Yes, that's what I'm recommending. That's what I'm recommending. And I would make it their future recommendation or their future applications contingent on their having those financials.
Thank you, Joda. Is agreement, disagreement? Are folks, are board members okay with going ahead and coming to a motion for recommendations?
This is Chris. I'm comfortable with where we stand on most, other than Hearthstone, just for the fact that I don't know what we're investing in based off of board members' word and their application. So I'm not as comfortable saying, hey, let's just go ahead and fund them for this year, knowing that we've funded them in the past, knowing that we're cutting two organizations that we know definitively are providing services. Not that they're not, but they're providing services that we can see that investment in those organizations. So I'd be more inclined to not fund them this year, and they could come back next year when they have financial information to provide to us, so we can make an informed decision on the investment of taxpayer dollars to that organization and give it to an organization that we can comfortably say we've done our due diligence and seeing their financial records to provide that investment in those organizations. Unfortunately, I'd rather not, but that's just my feeling.
Thank you, Chris. Ethan.
This is Ethan. I wonder, would it be possible to recommend funding contingent on them providing the financial documents? And then if they don't, it would automatically be reallocated among the other grantees equally?
The $9,000.
This is Danielle Bushcutter, staff liaison. I think if you all wanted to provide a recommendation to that effect, you certainly could. I think the difficulty becomes in what is sufficient documentation, and I think that's where a recommendation like that could get challenging, just because what one person deems as adequate, another board member may not deem as adequate. And so without that kind of coming back to you all, I think it is a bit challenging from a staff perspective to be making that call without some clear guidance from you all about what it is specifically that you would want or are looking for.
Thank you, Danielle. This is Leah Roselyn, Chair. Isn't it a requirement for funding to submit these? I guess it was my understanding that this was just, a requirement for funding, and that funding wouldn't be considered if all those requirements weren't met. And again, to me, this leads into equity, because if one organization, even though it's not a ton of funding, one organization is able to just submit an application with any of the other supplemental materials, then what is the impetus for the other nonprofits who also have smaller operating budgets to pay the, upwards of $10,000 for an annual audit, for example? I guess I'd like to get a better understanding of what the city requirements are.
This is Danielle Bushcutter, staff liaison. Really, the process for this recommendation really flows through you all. I think a little bit of this goes back to conversations the board has had previously about what do you do with an application that has not submitted everything at the time of the application. I will note, as I did in the memo, that there were a couple other agencies that submitted the 990 and the financial audit after the actual deadline date. So we do have that information available now, and was included in the agenda packet. But I don't think that there has been clear guidance from this board about what to do with applications that are not submitted fully. And I think that has been kind of an ongoing discussion. And I think a little bit of this also goes back to discussions that you all have had about potentially having some sort of matrices in place where you can kind of capture some of this information. And I know other advisory boards do that as well, where that's kind of a supplemental component of whatever scoring criteria they want to do, is whether or not the application was completed in full and on time. So I don't think there's been consistency in that regard. This is a recommendation coming from you all to the City Commission about how to use those funds. And so we do have parameters set forth in our agreements with agencies, and there is some language in there about access to some financial data, and I don't have that offhand, but I can certainly pull it up, and some kind of generic language in that regard. But in terms of what the recommendation is and what to do with applications that maybe aren't submitted in full, there has not been clear guidance as long as I've been a part of this board about what the board would like to do with those applications. So I think this may be an opportunity to identify that as a potential future discussion point, or something that you all want to continue to discuss here today. But there has not been clear guidance in that regard in any of the years that I have been a part of this advisory board.
This is Chris. I think the difference would be is that I think the majority of those, the ones that you've sent, we can find those on GuideStar. We have access to that independent of those organizations. We don't have we don't have the ability to have any sort of oversight from a financial perspective of the investment that we're making in someone like Hearthstone, independent of whatever information they provide us in an application form. So whether they give it to us on time or not, it's still information that we can access at any given time. Whereas, as Leah looked up, the last time we could see any sort of financial oversight of this organization was 2009. And I don't think we want to be necessarily the financial overseers of any one of these organizations. We do have to do our fiduciary obligation as committee members to make sure those taxpayer dollars are we're recommending the taxpayer dollars be used in an appropriate way.
This is Joda. Do we know how many years Hearthstone has been submitting applications and being able to just submit the applications without the financials? I mean, this might just be something that they're accustomed to doing. And if previous boards have let it slide, then, I'm just wondering what those implications and how that tradition is impacting their application this year.
This is Danielle Bushcutter, staff liaison. Again, I don't know offhand what the first year that they received special alcohol dollars was. I can, with some time, go back and do some of that research. I don't have that historical data pulled up. I will say over the last couple years, we definitely have changed the application. Obviously, the application process was different this year. I want to say it was 2 or 3 years ago before that where we also made updates to the application as well. So it has been a bit of an evolving application. I think the 990 and the financial audit have been a part of that application process for a number of years at this point. And is something that has been requested, I want to say, for several years related specifically to these dollars. So it has been part of the application process for a while.
Thank you.
This is Leah Roselyn, Chair. So with all of the information and discussion, I am leaning towards putting them in at zero funding for right now, even though it hurts my heart knowing the need. Looking at the website and the materials we have available, it does make me uncomfortable since we don't have a clear indication of where how the funds are being spent. It's not clear if there is a governance board with fiduciary oversight. And I do see that residents are paying to stay there. They're charged $125 a week for rent. And so for a room, which, may be below market value, but still it's difficult to get an understanding of how the funds are being utilized for what purposes. Yeah, so it pains me, but I'm uncomfortable with it from a financial sort of oversight viewpoint. So what are other thoughts about I guess I'm making a different recommendation than Joda. I would say put them in at zero for now and give them an opportunity to apply later with a full application like all the other applicants submitted. What are thoughts about that?
This is Joda, and once again, I feel the same way as I did before all this conversation about our responsibility. If they have been accustomed to doing this without the board coming back to them and suddenly saying, oh no, we're going to enforce this expectation this particular year. So if they've been accustomed, and I know last year they did not submit financials either. We had this kind of an application last year. So if they're accustomed to doing that, then I still think we should fund them contingent on their providing the financials within, say, a week.
Peter?
This is Peter Carttar, board member. I understand all of your suggestions. I at the same time, I do feel, I guess Joda and I are sort of newbies at this as well, and that this is our second go around. And so, we may be in the process of having Chris not learn bad habits from the rest of us, but I think it makes great sense to require the 990 and an audit and the financials. But as Danielle mentioned earlier, we've got a number of Van Gogh didn't provide, and I don't have access to the tax information that some of the rest of you apparently do. But Van Gogh and Hearland. I mean, Hearland provided a 990 from 2018, for heaven's sake, and there was no financial audit. So I am uncomfortable with moving the goalposts. And so while I recognize the importance, I think it's also real continuity to these organizations, particularly the smaller organizations, that herky-jerky support can have disastrous consequences. And I would be much more comfortable somehow communicating to them that it's a requirement that they provide some sort of financials.
Thank you, Peter. Yeah, this is Leah Roselyn, Chair. I feel, I am struggling. I think in past years, I didn't pay that much attention to it because I honestly had assumed that there was a vetting process that happened with the city staff, that we were only sort of given proposals that had met all the requirements, and I didn't take a close look at it, and I should have. So I acknowledge that I was not as thorough in past years as I should have been, and do think that a matrices, indicating all of the materials that are required, if they are required, then an application is not eligible for review if it's not fully submitted. Just so we're not making different expectations for different organizations. But that still leaves us, in kind of a bind. This year, I do hear Joda and Peter recommending going ahead and funding them, not changing the goalposts now, and then reinforcing that requirement next year. So Ethan, Tim, and Chris, I'd love to hear your thoughts on this.
Chair, this is Casey Toomey, Assistant City Manager, and I've been off camera, but listening to your discussion and trying to do some pulling documents up. And I did go back and find the 2020 application for Hearthstone, and their 990N form was attached at that point from 2018. So I think this was a bit of a transition where last year those items we actually had attached in while you have PDFs of the application materials this year, last year it was all in the computer, it was electronically submitted so that the 990 got attached at that point. So it may just be that they don't have a more current 990 in than this 2018. I think, Peter, you mentioned another agency that their 990 was from 2018. So I don't know if that further muddies the waters or clarifies the waters, but I did just want to point out that the 2018 990 in is out there. It's, as one of the board members described, a postcard and doesn't have a whole lot of information, but I did want you to know that it was out there.
And so Leah Roselyn, Chair, that's really helpful. Thank you, Casey. So with that information, Ethan, Tim, and Chris, what are your recommendations for Hearthstone? So we haven't heard from you yet.
This is Ethan. This is, as you said, this is really difficult. I think where I kind of come down on it is I think it would be unfair to penalize them this year for something that, I do think we would be moving the goalposts. And I understand that we have to have the responsibility to have oversight over this money, but I just think we would be unfairly bringing the hammer down on Hearthstone on this one, and also potentially, cutting a pretty important service. So I'm comfortable with funding them at the $9,000 this year and asking them for additional information, and also explicitly saying, if you don't submit a full application in future years, you will not get this money. And that's the rule going forward. So that's kind of where I land on all this.
Thank you, Ethan. Tim, what are your thoughts?
I agree with Ethan, especially this being, very specific to the charter and what we've been discussing from the beginning. It plays right into that. I'm fine with letting them know that they can't do that again.
Thank you, Tim. Chris, are you amenable to that?
Yeah, I don't view it as moving the goalpost as much as us as a committee saying, making the right decision on funding based off the facts and circumstances that we have. They've always known that some financial information is necessary to be provided, whether it's a 990 or financial statements. I know a definition of a financial audit is something very different for a lot of people, what they view that as. And some people aren't required to have a financial audit because of the size or the funding that they have. But us being able to make those type of decisions that we're doing our fiduciary obligation to the taxpayer dollars is important to whatever recommendation that I would make. And I don't feel like we're necessarily moving the goalpost. We're just making a decision, just like we felt like Boys and Girls Club has the opportunity to raise more money on a federal level and federal grants than a Van Gogh or whoever we did cut. So or didn't cut as much as Boys and Girls Club. I view it in the same way, and it's not necessarily penalizing them for not having a financial audit, but trying to make those same decisions. I'm comfortable funding that organization if I could see their financial information.
Thank you, Chris. We are not unanimous, so I guess in that case it would go to a roll count vote. Is there any other discussion about what to do with it right now? What I'm hearing from the majority of board members is that we keep them at 9, and that we enforce the requirement across the board next year. I guess for public record, that does make me uncomfortable allocating funding without any kind of indication of their budget, how the funding is going to be utilized or has been, but I acknowledge their importance and would go with the will of the board. I also noted Chris's comment about Van Gogh, and that although they did submit that to Danielle, it sounds like it's not up on the website in their application packet, and that in future we should be consistent in their requirements and only consider for review and funding fully submitted applications. Any comments or discussion about any of that? Okay. So right now, we are at a balanced budget. So unless there's any other further discussion, would anybody like to make a motion? Joda, did you raise your hand?
No, I was pushing a button to unmute, but I wasn't raising a hand. I was getting ready to second the motion, but I'm not articulate enough to be able to actually provide an emotion. I was hoping Peter would do it.
Peter, you have been nominated.
Looking for the mute button here. A question for Danielle. You know, because what we are doing is making a recommendation for action by the city commission, could we make a recommendation that we adopt the funding as shown, contingent upon Hearthstone coming up with a 990 or some recognizable financial document before the city commission makes its recommendation? And if they can do that, then basically it wouldn't require another meeting from us. Does that make sense?
This is Danielle Bushcutter, staff liaison. I think if you can be really clear in what your expectations are, that would be helpful, and what your alternative would be in the event that 990 for 2019, that 990N for 2019 is not available. I know that I've heard from a couple other agencies through this process and the general fund process about there being delays in some elements because of COVID and the impacts on that. And so I would want some really clear guidance if I did reach out to Hearthstone and they said it got delayed because of this, this, and this. And so 2018 N is the most recent version, how you all would expect that we proceed with something like that. I think is as long as there's really clear guidance from you all about what the expectations are, what's acceptable and what's not, you certainly could include that as part of your motion. And then when it goes forward to the city commission, we could certainly provide that additional documentation and note that the board had this discussion.
Along with that question goes the sort of a follow-up question that if a 990 from 2018 is what we have in our possession, is that right, Casey? Then we may already have something that is acceptable to us if it is acceptable for Heartland, which is what is in their application is a 990 from 2018.
This is Chris. To be clear, there's a significant difference between a 990 and a 990N. 990 provides full representation of the ins and the outs for the most part. It kind of mirrors what the financial audit would say. 990N is just this. It's your name, your address, and your principal officer, and a box that you're checked that your gross receipts are less than 50,000. That's the full freight of a 990N.
Well, so much for my easy solution then.
and you never want to put an undue burden on someone that isn't required to have an audit. I wouldn't want to request an audit of this organization specifically for funding from the city because, like Leah had said, those are uppers of $10,000. That's a steep price to pay for a $10,000 funding. But whether they have an outside agency do an independent compilation or even just putting together their QuickBooks file or something of that nature, us at least being able to see some financial records of theirs would go a long way of showing kind of what other revenue they have, how much revenue they have, how much are they spending? Are they spending it all on staffing? Are we funding 100% of the staffing of this organization? I'm not opposed to funding this. I think this fits squarely in the ordinance that we're trying to fulfill. It's just lack of information as a whole for me to feel comfortable with that small, even that small of amount, but it's still taxpayer dollars.
Chair, this is Casey Toomey, Assistant City Manager again. So I pulled the 2020 agreement for use of city funds that the city has with Hearthstone. And let me just verify I pulled the right one. Oh, sorry. I regress. I pulled Heartland instead. Let me go back. I withdraw my comment.
This is Chris again, and why she's looking at that. The 2018 wouldn't be an unreasonable 990 for some organizations to provide, because with COVID, and not even without COVID, but the 990 filing deadline is November 15th with extensions. So there are some organizations by the application date that wouldn't necessarily have their 990 done. A lot of audits, like I'd say Hearland, I don't know about Heartland's, but a lot of audits got delayed significantly because those auditors couldn't be on site. So most of those summer and fall audits got pushed, and most people wait to get their 990 done until the audit is done. So the delay in the audit does have a delay in the 990. And then most of them are being pushed up against that November 15th filing deadline. So it's not unreasonable to expect the 2018 to be the only available 990 for organizations during 2020 for 2019.
So this is Casey Toomey, Assistant City Manager again. Oh, Danielle, looks like she's pulled up that agreement. And I was going to draw everyone's attention to Section 4 and Section 5 that talks about reporting requirements and retention and access of records. So again, this is the agreement that we have Hearthstone sign for the use of city funds. And there is, in Section 4B, you'll see that the grantee agrees to comply with a state statute that requires not-for-profit entities to document and make available the receipt and expenditure of such funds. And then it goes on in Section 5 under subsection A to say that the grantee will give the city or any other authorized representatives of the city access and the right to examine all records related to the expenditure of city funds. So I do think we have the ability to reach back out to Hearthstone and say, we're invoking this section of this agreement and ask that they provide something by way of complying with this section of the agreement. I think, so then back to Danielle's point about the clarity of your motion, we would sort of need a contingency of, if they're able to provide something, then this; if they're not, then this. What to do with those funds that you would, assuming you would otherwise allocate them if Hearthstone were unable to provide something that would comply with the terms of this agreement.
Peter Carttar, board member. So, Casey, if we were to make the recommendation that we adopt the funding as presented in Danielle's spreadsheet, contingent upon the city receiving the financial information per the agreement, would staff have the information that they need not only to make the request of Hearthstone, but also to judge its quality once submitted?
This is Casey Toomey, Assistant City Manager. I think that's a good question. I guess what I would say is the language in this agreement says receipt and expenditures of such funds. So, and there is that statute there. So I I think it, your board member talked about the difference between an audit and a compilation. I don't even think a receipts and, a receipt and expenditure of such funds raises to that level. So it may just be here's our QuickBooks spreadsheet or something along those lines. So to me, it's a very low bar. But I think as far as I know, in my years of being here, we've never done that. So I don't have a good precedent that I could point to as far as what we accept to satisfy that and what we don't.
This is Leah Roselyn, Chair. To further muddy the waters, I'm looking more closely at the program budget that they included with their application, and the revenue and expenses don't balance. So they show an $8,015 surplus in revenue over program expenses, and no indication again of if there's other expenses other than this. I'm assuming this is their total operating budget. Since we don't have any other financials, we don't know. But they're showing an $8,000 surplus based on the only financials we have available to see. And so based on what we do have to see, I would not recommend funding any more than the difference. So if they only need an additional 3,000 for a balanced budget, why give them 11 when there are other agencies that certainly do not have a surplus? So I guess the more I look into, just the fine details about it, it raises a lot of questions for me. And I am not comfortable. So I would not be comfortable, personally voting in favor of even a 9,000. The budget they submitted shows they don't need it.
This is Chris. I could support that motion, that funding where we balance their budget based off of their budgeted information that they've provided.
I agree.
This is Ethan. I'm amenable to that as well.
This is Danielle Bushcutter, staff liaison. I just want to apologize for all the screen sharing, unsharing, and
sharing, but I'm going to reshare again to pull up that spreadsheet so that you all can look at that as you continue this discussion.
So it sounds like agreement about putting them in. Okay. So now we have 6,000 to reallocate to some other agencies. Are there recommendations for where that might go? So hearing none, I might recommend either putting the 6.5% reductions down to 6, or the ones that are 10.7, 10.8 down to 10, or whatever the numbers are. And I'm open to either. Would love to hear any suggestions from the board.
This is Joda. I say we try the 6% instead of the 6.5.
This is Leah Roselyn, Chair. Sorry, Danielle, do you read that math for us? Thank you, friend. So now we have 5660. we go back and add some to the Boys and Girls Club and Heartland? Or do folks have I see a head nod from Peter. Are there other recommendations? Yeah. So what do folks think about just splitting the difference evenly between those two or putting them at 10? Which one? Sorry. Tim, please.
Yeah, I'd say let's go with that.
How should we reallocate the remaining 4,000 and change?
And do everybody do 9.5 and 5.5?
That work, Danielle?
Still got a bunch.
Any other? Ethan?
I was just gonna say, do we go to 5 and 9?
Let's look at it that way. We are so lucky to have Danielle as a staff support. She is so skilled in so many ways. Thank you, Danielle.
Chair, this is Casey Toomey, Assistant City Manager. I'm going to brag on Danielle just a second. So she's going to blush, but she just received a Early Career Excellence Award from our Kansas Association of City Managers. So I probably didn't say the exact name correctly, but I'm going to brag on her anyway.
Congratulations, Danielle. You are such a freaking rock star.
Thank you.
Well deserved, Danielle. Well deserved.
Absolutely.
This is Danielle Bushcutter, Staff Liaison. Do you all want me to go up another 0.5% until we hit our threshold? Is that helpful for you all to see it in that increment?
Let's see, head nods from most members.
Okay.
Let's try it. All right, so we're so close. I think doing more 0.5% across the board would probably take us over. So I would make a recommendation to evenly split the 530 between Ballard and Van Gogh. Any other recommendations from the board?
I recommend that it all go to Ballard. That's just I think they provide multiple services to a larger population, a greater population.
So because they serve more people, perhaps justifying.
Yes, that's my articulation problem. That is exactly what I mean.
I don't see any disagreement with that. Oof. All right. We're back at a balanced budget. So let's, this is Leah Roselyn Chair. Let's go ahead and do another across the board, just look at it, gut check, and then if anybody would like to make a motion for recommendations. Okay.
This is, oh, I'm sorry, Chris.
This is Chris. I was going to make a motion, then I realized I'm not eloquent enough to make such a motion. I always fumble.
Yeah, this is Joda. I do too. I am suggesting though that that with Hearthstone, we actually tell them our reasoning somehow for recommending only 3,000. That they know that it has to be that going forward, their financials have to be more detailed than what they've presented. So that's my only stipulation or my only request is that Hearthstone know why their grant has been suggested at a much lower amount than what they requested.
This is Leah Roselyn, Chair. Thank you for that, Joda. Yeah, I think that there does need to be communication about the expectations of their finances and how we came to that recommendation according to the line item budget we do have access to. Is somebody ready to make a motion? Do we need more discussion? Is it just a matter of wordsmithing at this point?
This is Ethan. Do we need to include contacting Hearthstone in the motion?
This is Danielle Bushcutter, staff liaison. I'm happy to do it either way. Casey, I don't know if you have strong feelings about it. I'm fine if the motion is for this and either a subsequent motion is reaching out to Hearthstone, but I certainly have it in my notes and we'll be doing that following this meeting.
This is Casey Toomey, Assistant City Manager. Just to clarify, so the motion for funding isn't, the 3,000 isn't contingent on getting additional information, have we, or it still is? That's where I was unclear.
This is Leah Roselyn, Chair. My understanding is that the board is interested in going, well, let me do a check actually, because I saw a couple head nods. So Tim and Chris, you both shook your heads with that. Affirmative, go ahead and approve funding for 3,000. Okay. Yeah, so it sounds like we're comfortable approving the 3,000 regardless of what we have for financials, still requesting them, but not making that contingent upon funding.
Thank you, Chair. So this is Casey Toomey, Assistant City Manager again. I think having said that, then obviously this Zoom meeting is recorded and the minutes and the link to it will be attached as part of the agenda memo that goes to the City Commission. So I think that we can allude to to this in the memo to say that kind of sum up this discussion and say that the board wants to make it clear that going forward, applications that don't have the financial documentation provided will not be considered. And Danielle, being the gifted person that she is, will communicate that effectively in the memo. That would be my suggestion for how you all could move forward, so you don't necessarily need it in your motion.
All right, so this is Ethan. In that case, I would move that the recommendations as shown on Danielle's Excel sheet be forwarded to the City Commission as this advisory board's recommendations for 2021 funding for the Special Alcohol Fund.
Peter Carter, board member, I second the motion.
Okay, so motion by Ethan, seconded by Peter. Is there any discussion? Okay, let's go to roll call vote. Tim.
Aye.
Chris.
Aye.
Joda.
Aye.
Leah Roselyn, an aye for me. So the motion passes unanimously. Thank you all so much for your hard work. That was a really productive and thoughtful conversation, and I feel so honored to be on this committee with all of you, so thank you. We do have some other agenda items with just a half an hour left. We've been here for quite a while. I'm wondering if anybody else needs a short break or if we should power through. Looks like power through. Okay. Okay. So
this is Joda. I am going to walk away from the desk a minute. I need some socks on my feet. My feet are cold, so I won't be here for a second, okay?
Okay. Leah Roselyn, Chair. Thank you, Joda, for that heads up. So let's go ahead and go to action item, agenda item C2. Action item to approve the 2020 outside agency annual report form.
This is Danielle Bushcutter, staff.
And I can give a brief update. This was on initially on the meeting last month. However, we did not have a quorum. So I know we have a couple new board members, so I'll kind of go over maybe in a little bit more detail than I would otherwise what this is. But one of the duties and responsibilities of this advisory board, in addition to the recommendation that you all just got done making for 2021, is to evaluate, in line with much of your discussion, the use of city funds by recipients and report those to the City Commission as you all deem appropriate. So we have an annual report form that we ask each agency to fill out by the 15th of February every year related to how they actually spent the dollars. So the annual report form that you all are looking at today, and I'll go ahead and share my screen in just a second, is for the use of 2020 dollars. So typically with this board, we're always working in multiple years. So this is really looking at what information do you all want from the agencies related to how they spent and how they used dollars in a given year. So I'm going to go ahead and share my screen really quickly and kind of walk through the report form that has been used in the past. There was discussion when this board reviewed the 2019 annual report forms that there was some desire to make some adjustments to the 2020 annual report form. So this is really your opportunity to discuss any changes you all would like to make. So I included the application form just to make sure that, you know, any questions that you all would like to maybe modify or change. We have some of that detail in the application form, but we'll head over to the 2020 form. And this is what it looks like based on what we used for 2019. So really a high-level form. The first question is really to provide a success story of the agency related to how these dollars were used. The second question is in line with a brief narrative of the activities that were funded with city funds. And then question 3 really gets at the outcomes that were listed and whether or not those outcomes were met with within that calendar year. And then finally, referring back again to kind of that line item budget that agencies provided in their application for funding, and identifying how accurate those allocations were in regards to how funds were actually spent. So this is the high level form. I know you all probably have some ideas for some additional suggested changes, and this is really the opportunity for you all to make those recommendations. So I'm going to stop sharing my screen, and as you all kind of have that discussion, but if I need to bring it back up, I certainly will.
This is Leah Roselyn, Chair. Thank you so much, Danielle. So let's open it up for discussion, thoughts, recommended changes, or if members are ready to approve. I did have one question off the top, Danielle. I was trying to look for the 2019 or 2020 application and I couldn't find it in my file. So were they asked specifically to list 3 outcomes that they would achieve, or what was the language in that? Yeah, it was outcomes.
Yeah, this is Danielle Bushcutter, staff liaison. I'm scrolling through the application. I do believe it was very specific in identifying 3 outcomes, and those are typically what we include in their agreement for funding that Casey mentioned earlier as well.
Thank you, Danielle. This is Leah Roselyn, Chair. So where would they report outputs then? Would that just be rolled up into the outcomes? So just like the simple numbers served, etc.?
So this is Danielle Bushcutter, staff liaison. So again, this is where we're kind of working in multiple years. So the applications that you all just reviewed were for 2021 funding. So there were some of those output measures and language in that application. In the 2020 application, which is what this annual report is for, we did not have that language. So there was a question, I believe, in the application related to number of clients served, but as it relates to the objectives, the language is really broad. It just says, please provide 3 specific program objectives for 2020, and it gives additional detail, but it is really high level.
This is Leah Roselyn, Chair. Thank you for that clarification, Danielle. Are there, do any board members have recommendations for changes or discussion? Seeing none, if it's consistent with the application, I'm fine with that. I guess my only comment is to use the language that is consistent with the application. So if the application for 2020 used the language of objectives, that's what we would use in the report. If it did say outcomes, that's what we would use. But I think that's a rather simple technical change if it does need to be one. So seeing no discussion, would anybody like to make a motion? Tim.
Motion to, sorry, trying to think of how to word it. Motion to approve the 2020 outside agency annual report form as is.
Thank you, Tim. Is there a second?
I'll second. This is Chris.
All right, seconded by Chris. Any discussion? Okay, let's go to roll call vote. Peter.
Aye.
Peter Joda.
Aye.
Ethan.
Aye.
It's an aye for me, so the motion carries unanimously. Let's go to the next agenda item. I have to scroll up in my agenda, I'm sorry. So we are on C3, consider approval of 2021 meeting calendar. So the proposed dates for 2021 meetings are shown on the executive summary here. Friday, February 19th, May 21st, August 20th, and November 19th. Any discussion or changes? Okay. That looks good for everybody's calendar.
Yes.
Thank you, Joda. Danielle, well, actually, I'll ask you a question offline. I had a question about about my term, but we can do that offline. Okay, so would somebody like to make a motion to approve these 2021 meeting dates?
So moved.
Peter is making a motion to approve the 2021 meeting dates. Is there a second?
This is Joda. I second.
Okay, seconded by Joda. So we'll go to roll call vote. Chris?
Aye.
Ethan?
Aye.
Tim?
Aye.
An aye for me, so the motion passes unanimously. We have our 2021 meeting calendar. Excellent. There is no, I know, yay! There's no new business.
Hey, Leah, this is Danielle Bushcutter, staff liaison.
It's not on here, but I do want to use this opportunity just to let the board know that I have talked to Galena Miller, who is still listed as a current member of this advisory board, and she has resigned from the board. So I just wanted to let you all know that after this meeting, we'll go through kind of that process to get that spot filled. But just wanted to let you know and also thank her for all of her years of service on this board. She had been on the board when it was still the Social Service Funding Advisory Board. So I just want to take this opportunity to thank her for her time and all of her previous years serving as a board member on this board, and let you all know that that had occurred. So thank you.
This is Leah Roselyn, Chair. Thank you for that. I've been wondering about her. And thank you, Galena, if you're watching, for all your service and everything you do for our community. Is there anybody there for public comment, Danielle?
This is Danielle Bushcutter, staff liaison. There is no one physically in the room here for public comment, and I don't see anyone raising their hand in terms of participants in the Zoom meeting. So I'll give it just another second here, but I do not believe we have any public comment at this time.
All right, thank you. So moving on, we have our calendar we just approved. It looks like at our next meeting, we get to elect a new chair and vice chair, and we will be reviewing the charter ordinance. Any other comments about the calendar, Danielle, that we need to be informed of?
Danielle Bushcutter, staff liaison. There's nothing else that I need from you all, although if I know there was some discussion at the meeting today about matrices and using something in that regard. So if that is an item that you all would like to get a meeting date identified to have that discussion, this would be an appropriate time to do it. If not, staff can kind of roll that in there in one of those future meetings for next year.
This is Leah Roselyn, Chair. Thank you, Danielle. I was wondering if we might be able to, at that February meeting, get what the other advisory boards use, that you had noted that there are some others that use a matrix. I think that would be helpful to review, and if possible, bring into alignment for consistency across city boards. Are there other requests from other board members or comments? Okay, is there anything else, Danielle?
No.
Is there anything else from the board? Ethan.
Yeah, this is Ethan. Just want to say thank you to you, Leah, for leading us through these meetings this year. I really appreciate your leadership and guidance. And then also, of course, thank you, Danielle, for all the work that you've done this whole year. I can't imagine having to help us out with all these different requests. So just thank you.
This is Leah Roselyn, Chair. I know she is such a rock star. It makes it look so easy. Thanks to all of you for your incredible service. Tim and Chris, we're so happy to have you joining us, and I look forward to seeing you all back in February. So with that, there doesn't need to be a motion to adjourn, right? We can just call it?
Yep.
Okay. So the meeting is adjourned at 12:08. All right.
Wonderful. Thank you all. I really appreciate it.
See you guys.
Thanks. Take care.
Very